Good morning, everyone. As chair of the subcommittee on SB 155, I find that due to the state of emergency declared by the governor as a result of COVID-19 pandemic, and in accordance with House Rule 67 and the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. Please note that there is no physical location for members of the public to observe and listen contemporaneously to this meeting. However, in accordance with the emergency order, I am confirming that all members of the committee and select legislative staff have the ability to communicate contemporaneously during this meeting through the Zoom electronic meeting platform. And the public has access to contemporaneously listen and, if necessary, participate in this meeting by the Zoom platform or by telephone. All necessary access information has been made available in the House calendar through the electronic calendar on the General Court website. The notice for this meeting complies with House rules and RSA 91A. Anyone who has a problem accessing this meeting should call 603-271-3600 or email hcs@leg.state.nh.us. In the event the public is unable to access the meeting will be adjourned and rescheduled. Please note that all votes are taken during the meeting shall be done by a roll call vote. Let's start the meeting by taking roll call attendance. When each member states they're present, please also state whether there's anyone in the room with you during this meeting, which is required under the right to know law. Representative Lekes.
I'm present in the committee room.
Representative Grota.
I am present in my home office alone.
Representative Schultz.
Good morning. I am present in Concord in my home, and my husband will be in and out of the room.
And Representative Lanzar.
Hi, good morning. In Nashua at home and some family here and there.
Very good, thank you. Okay, let's begin. HB 155. Excuse me, SB 155. This bill establishes the position of temporary health partner, authorizes emergency licensing of medical providers, authorizes COVID-19 testing and vaccination by pharmacists and pharmacy technicians, permits out-of-state pharmacies providing investigational drugs to clinical trial participants in New Hampshire to be temporarily licensed as mail-order pharmacies, protects the pre-existing non-conforming use status of summer camps that were unable to operate during the summer of 2020 due to COVID-19, and establishes procedures to allow construction to continue during the pandemic and temporarily allows expanded outdoor dining. There's also a amendment before us today that we'll be discussing as well. We'll get to that in due course. Anyone have any thoughts? Let's see where we stand on this. Representative Lekes.
I'm a temporary health partner one.
Yeah.
I'm okay with that. We actually discussed this some as part of, I think there was an item in 133 that was related to this, but it just seems, I think it was permitted under the state of emergency, and I think the idea is to let people get a foot in the door with minimal training and get further training both on the job, and then they're still going to be required to do the continuing education. And and then they can proceed if they want to actually become LNAs, in which case they'll have to meet all the LNA requirements. But at least and the testimony we've heard is that it will get them in the door. They could decide if that's something they wanted to do, and it will also provide some much needed assistance for nurses and LNAs,
which we have an incredible shortage of right now. Let's see, Representative Grota.
Thank you, Mr. Chair. State of emergencies are enacted because, executive orders during state of emergencies are enacted because of a certain situation. In this case, it was the need for healthcare workers due to the COVID pandemic and the increase in hospitalizations for people who had contracted that virus. I don't believe that things like this that are put under executive order in an emergency are warranted to continue. I don't support, reducing the requirements for this position permanently based on the current situation. I believe that people who are LNAs should have the qualifications to start. And I don't support this part of House Bill 155.
Okay. Representative Pearson.
Yes, thank you, Mr. Chairman. The committee of which I'm the chairman, which is Health, Human Services, and Elderly Affairs Committee, is comprised mostly of doctors and psychologists and therapists and medical administrators and so on. No surprise there. And we've looked at the idea of various P-A-R-A, personnel, not just in emergencies, but going forward. We're trying to figure out what we can do to help the underserved areas, not just the Northland, but other places as well. And while we are very convinced that people need to be trained and supervised all up and down the various, ladders of professional jobs, we also see there is a place, not just in an emergency, but at other times, for such well, we're calling them emergency workers now, but going forward, they might not be. But people who can come in, be specifically trained to a task or two, be supervised, and as a previous speaker said, decide whether this is for them or not. So just coming as an outsider from another committee, this is the kind of thing that we've looked upon with some favor.
Thank you. Representative Schmidt.
Thank you, Mr. Chairman. Appreciate the opportunity to sit in on the committee subcommittee this morning. I'd like to supplement a little bit of what both my predecessors have said this morning. LNAs perform vital functions, but not primarily, as I understand, but because especially in nursing homes, the care of people who are frail and possibly unable to take care of things like toileting themselves and feeding themselves and so forth in a reliable fashion. To the degree that the LNAs are not there to do this vital, crucial work, it's going to have to be done by somebody else. And if that person is an RN, who would likely be the next person in line, then that takes them away from medical functions which they can perform, but LNAs cannot. In addition to what Representative Lekes said, it's not merely a question of getting these people in the door. Many of them are already in the door, statewide anyway, perform these functions. And as I say, these are crucial, vital functions that have to be done in order for the patients at nursing homes to be adequately cared for. Care is the underlying word here, and the medical care, but physical care that they need. So I'm very much in support of this, and I certainly will vote for it in the committee when it comes time.
Thank you. Representative Schultz.
Mr. Chair, you're muffled. Are you calling me?
I was calling Representative Schultz. I see her hand up.
We couldn't hear you. Sorry.
Yeah, sorry, it mumbled a little bit. Yeah, we're having a hard time hearing you this morning, Mr. Chair, for whatever reason. I just have a few questions. I saw my mother-in-law become an LNA, and the training that she went through was kind of interesting. It was sponsored by the Red Cross. The sort of training that LNAs go through typically isn't, while it can be through traditional, like community colleges and whatnot, it isn't at least what she went through, the traditional type of higher education that I had assumed it would be, which I found interesting. I'm curious to know then, with this designation of someone who's in training, what is the pay differential? And is there any sort of tuition or fee that they would be responsible for?
Let's see if we have anyone who can answer that question. If anyone is in the attendees who can answer that question, please raise your hand. I don't see anybody jumping to raise their hand.
And I'll just then, if no one can answer the question, one of the things that I did like about the training that she went through is, as an incentive to get folks into those training classes, there was a guarantee that any tuition being paid would be, that debt would be cleared once someone had served in a certain job by 6 months or whatever. I actually thought that whole scheme was kind of ridiculous. So I'm very open to this change, especially since there's such a desperate need for for folks to perform these jobs. And I can't see why, so long as the important parts of the training curriculum are met and included in some way, shape, or fashion, this might actually be better for the folks going into this field. They wouldn't have to incur any debt at the outset, but I am also still concerned then to know if there is any traditional pay, or if it's some sort of a training rate. I'm concerned about pay and tuition. This might be a great way to get around student loan debt for this type of position, and I like that. But having the answer to that would be very important. And if there's a pay, a graded scale of pay for people who are in training versus LNAs themselves, if someone can answer that.
Thank you. I don't see anything in the statute that refers to pay level, so I guess that would be up to the employer. But we'll keep an eye out for anyone who thinks they can answer that as the hearing goes forward.
Sure.
Yeah, go ahead, President.
As I recall, there was a question about that. I think what we were hearing related to 133 and pay, especially for the nursing homes, and it is.
I'm sorry, Mr. Chair, and I, Representative Lekis, I'm so sorry to interrupt you. I'm just having a horrible time hearing you there in the committee room. The sound is different than it normally is, and we want to hear you.
Is this any better?
No, it sounds muffled.
And I've got a microphone here. I don't know if it's enabled, but.
Maybe we need someone from the staff to help. I don't know if it's that's what they do, but it's definitely not as good as it normally is.
I can contact IT to see if he can help out at all.
Yeah, if you don't mind, I appreciate that.
Is this any better? I'm trying a different microphone.
That's better.
Better. Yes.
Okay, in the meantime, while we're trying to get our technical difficulties sorted out, Representative Schuett.
Thank you so much.
I believe you just called on me, Mr. Chair. Now you're muffled.
Yes, he did. It was you, Representative Schuett, he called on.
Thank you. I'm not sure this may be a question for Representative Pearson, since he is here from Health and Human Services. Since we know that even LNAs are technically paid less than what one would hope to do the work that they do, and these temporary health workers, I understand, are paid even less than LNAs are. This committee did not hear any great outpouring from folks doing this kind of work with interest into this program. I was wondering if Health and Human Services heard from many folks who would be interested in taking advantage of this.
Thank you, Representative Schuett. And on the sliding down pay scale, legislators are paid even less. We heard from a few. We didn't hear from a lot. We heard from other legislators who have been contacted by people who are interested. My county job is to be one who looks over our county nursing home. And from that direct supervision, I can tell you, we could use a lot of people at various levels. And because we cannot get the kind of people that we might normally want in a particular slot, we found this idea to be very helpful and very creative. But more directly to one of your questions, we really didn't discuss specifically pay. I know in the medical facility that I am CEO of, is one of my day jobs, we bring in people on a training wage. And if they look pretty good, we give them a regular job and bump up their pay accordingly and make up for some of the shortfall during their training period. I think this would probably be up to the facility in question.
Thank you. Being chair of my county delegation, I'm aware of what happened at our Merrimack County Nursing House. But again, like I said, I know this being lesser pay and the incentive pay from a public nursing home is not as easily made up, perhaps, as at a private. I thank you for the answer.
Welcome.
$331,760 on your home, and you haven't missed a single mortgage payment in 6 months.
I think that
Check out Congress's mortgage.
Is there a mic on, please? Thank you. Representative Golden.
Thank you, Mr. Chair. And I, too, I don't think would support this section of the bill. You look at what we've done is created a position for the pandemic, a temporary health partner. And this was to address staffing shortages at long-term facilities to meet the needs. If you read on further, it goes on to say it's a temporary position. And temporary is not defined here. Are these going to be temporary full-time positions or truly temporary positions? Well, I understand the need for LNAs and understand the issues they're having in bringing in LNAs. I think the problem with that is pay. Not that there's not enough qualified candidates out there. I think we're looking at the pay structure going forward. And to bring in a temporary health partner at a lower scale than an LNA, I don't think is going to work. Scope of work, a temporary health partner. THP is a temporary position. This is directly from the bill. Limited to assist LNAs. No definition of temporary. And that's what I have an issue with. This is supposed to be temporary to address an emergency situation which we're in. This, I don't think, was meant to be long-term. And the other question I have, and I don't remember if this was brought forward in the public hearing or not, for the county nursing homes or any of the nursing homes out there, is this reimbursable through Medicare, Medicaid? Because if not, it's going to be an added expense to these facilities.
I think that was touched on at 133 hearing. All that, Representative Lexus.
Yeah, 133, we got the question as well for these. And as I recall, they said it was reimbursed by Medicare, Medicaid, and that actually limited, how much could be paid. I have a question from my follow-up. A question for Representative Pearson, and that is, do we have any idea how many of these health partners actually were employed during the pandemic? And the reason I bring this up is that maybe there was a surge in need during the pandemic, but my understanding is it's been a serious problem for quite a while, and it's not going to end with the pandemic. So I'm wondering, once this was put, the people actually stepped up and did this.
Pearson, did you have a question?
Sorry, I'm sorry, Mr. Chair, your audio is going in and out again. Did you call on me?
Zara asked a question.
No, not this.
Just so you know, I have contacted IT and I'm not sure exactly where he is in the building, but Ryan Dorrington is on the way, so he's alerted to the problem.
Okay, Ms. Mara?
To expand it, definitely have education.
Yes, did you call my name?
Given we probably need to expand it to also.
Oh, it's really not working.
People in the medical.
Is there a gain adjustment on the microphone?
Is there I'm sorry?
Asked if there was a gain adjustment on the microphone, and Representative was looking at it. We're doing a little, trying to do some self-help.
Okay.
For what it's worth, since I mostly understood what you just said, it does sound like from our end, if the output of your microphone is too high, like it's too reverberating from noise on our side, that does muffle what you say. So if you have the ability to control the volume of the output of your mic, if that makes sense to what we hear, I think if you lower it a little bit, that's what the distortion sounds like it's too loud.
No, any difference? Any difference?
Same.
No.
How about for me on this mic that I'm on?
A little bit better.
So Representative Pearson can hear me. Question, if you didn't hear it, was, first of all, is this an ongoing issue that's not specific to the pandemic? Second, how many of these temporary health partners were hired during the while the emergency order was in place? I guess it still is.
I think I heard my name. If that's true, I'll continue. If not, just somebody wave me off.
Sorry.
We have a need for such people, in my opinion, both during an emergency and ongoing, because prior to the pandemic, Rockingham County Nursing Home was still at wit's end, needing people at all levels, but a temporary level below our normal low level was considered a good thing to have. Again, people may decide they like it and then go back and get a certificate or even a degree, or they may decide they don't like it and seek employment elsewhere. But it is like a temp job in high school. It is temp, but for some people that turned into something regular. I see the need straight across the board when the pandemic lifts and when it doesn't. Of course, we have the question of the bill before us, which addresses temporary.
I can follow up?
Yes.
So the question was raised, and I have it as well. What makes this temporary? I mean, should that term actually be in the bill? We might hope that such people would move up to LNA, but is that actually a requirement? And if so, what's the definition of temporary in this context?
Well, I'm doing something I told my committee to do, and that's read the bill. It's very informative. I don't see a definition. I would want one.
Yeah.
If I can interrupt, I just want to test. Does this microphone sound better now?
Way better.
Okay. Thank you.
And does this one working okay?
Yes.
Thank you.
All right. I think we're back in business.
Yeah, I did read the bill and I didn't see it, so I just thought you might have a better idea of the intent.
If I may, I agree with Representative Lekis. I have a concern about creating a class of employee that's goal is to become an LNA, but there's no clear definition of when that should happen. So what would prevent creating this subclass that was there forever without actually being able to make LNA?
Mr. Chair, if I could.
Yes, go ahead, Representative Gordon.
So this is addressing my concern, which was I don't see any. We've had earlier bills where people who worked at a certain position that didn't have the training were allowed to continue that because they had either worked during the pandemic to account for their training, or they had worked enough hours that they could be promoted to that position. They could get licensure for that. I don't see that here. I see that this is a temporary, we're creating a class of people who are going to receive lower pay and have lower requirements. And I don't, that's my concern with this bill. If these people had access to the LNA position, or it was a road to that, that's a whole different thing. So I think that's the crux of my concern with the bill. And I appreciate everyone helping me get to that.
Representative Pearson.
Yes, thank you, Mr. Chairman. My aunt Janet was in the test class for nurse practitioners in Massachusetts 40 years ago, and they were called a variety of names, not good enough to be a doctor, a subclass, I remember that. But what my aunt demonstrated, and the two nurse practitioners that are under my employ demonstrate, is probably at age 22, they weren't ready to go to medical school. So they did come in eventually as a subclass called nurse practitioner. And some of the nurse practitioners now have gone back and become DOs or MDs. And that's a good thing. Many of them stay where they are. So subclass or lower level, I heard the sneers behind the use of that term 40 years ago, but I didn't see it as such. I just saw it as somebody who could move from where she was to a better position. And eventually, some of them went on to be better yet and better yet and better yet. And I could see temporary, and I reiterate, I want a definition here. A temporary person coming in at a lower level is not necessarily a bad thing. I don't think it's demeaning to people. I think it may be the lower rung on the ladder that they can best put their foot on at this time, and maybe come up higher and then higher yet.
I tend to agree. I don't have an issue with having a separate class that's only there as a stepping stone. But a temporary seems to be the sticking point here. Is when does that become no longer temporary? Representative Schuett.
Thank you, Mr. Chair. And perhaps Representative Pearson can answer this thought that occurred to me. We know that healthcare workers were granted bonus pay, if you would call it that, during the pandemic. Were these folks included in that?
I don't know how we would know that. That would be dependent on an employer. That's not a.
Well, I was thinking perhaps Mr. Representative Pearson might know that from his outside connection.
I see him shaking his head. No, he doesn't.
Oh, sorry.
Okay, thank you.
Representative Schultz.
Okay, sorry about that. I do see still a lot of folks in the attendees list. If any of them have an understanding of how pay differential is for these two positions, that would be helpful. It sounds like there are already these sort of programs predominantly because of the pandemic, but I would say if this gives folks a chance to earn a paycheck and avoid the student loan debt from the LNA program, training programs, this actually might be a net gain for them. I think though LNA pay in general, and is it definitely in the category of workers that definitely needs a boost, and I agree with everything that Representative Goley says about that, but if the differential in avoiding student loan debt for the training programs and they earn a paycheck at the same time, might be a better bargain for that period, I believe. But it would be nice to hear some confirmation of that from anyone in the field. I see someone from Dartmouth Hitchcock is in the attendees list, and other folks that we know very well. It would be great if we could, if I don't get the answer to the question during the subcommittee, I'm definitely going to call around and get the answer from various sources I have, if anybody has any recommendations for that. because I think that's, to me, the biggest sticking point. If they're getting the same curriculum they would get through the official training programs, and they're being paid, and they're avoiding student loan debt, I think this is a good path, actually. But I don't have confirmation of that yet.
So, Mr.
Yes, thank you. I think that's an interesting to know the pay differential, but I don't know that it's necessarily important as far as getting the language of the bill correct, because the pay is going to be different at every place, and it's really going to be set by the market. I'm more concerned about creating a permanent class of people who would then be allowed to be paid less because they don't have the same credentials that an LNA would have. This should only be a stepping stone to LNA, not a permanent class of people that would be paid lower. So it's tangential in that regard, but it would be interesting to know. Representative Allegro.
Thank you. Thank you for taking my question. I'm not on this committee, but I wanted to be here this morning because I think this is important enough that I made the time to come in early. As someone who has done this kind of work, help people stand, help people walk, push wheelchairs, wipe bottoms, and held hands, I know it's important work. And it doesn't rise at that to the same level as what these people will aspire to. I just want to say that we had a shortage before the pandemic. We're going to have a shortage after the pandemic. And I think we're getting a little far afield and splitting hairs, worrying about creating an underclass and what their pay is going to be and how temporary is temporary. I'll just finish by saying that there's no experience for a position like this than firsthand practical experience, and much more important than classroom training and credits and that sort of stuff. And I support this way to ease the way for people to get into this profession as much as possible.
Mr. Chair.
Thank you. Representative Lekes.
Thank you, Mr. Chair. I actually am not so concerned about a lack of a definition of temporary, as it seems to be language that isn't necessary. I mean, I would support amending this to get rid of, call them health partners and get rid of temporary. I mean, if somebody, we're certainly going to have the opportunity there.
3 members of the House of Representatives appointed by the Speaker.
My
understanding was you thought that could be further delineated.
Yes, I do.
Okay. Something's going on.
Pam, you need to mute.
After this meeting.
Sorry.
Okay, thank you. Anyway, so I'd be okay just calling them health partners if they're there and getting the experience. They're certainly, they're making some money and certainly have the opportunity, if they choose, to work towards an LNA. I don't think it needs to be spelled out explicitly. And if somebody doesn't want to do that for some reason, and they want to continue for some period of time, maybe even a longer period of time, doing the kind of work under the supervision of an LNA or, RN or, that the health partners are allowed to do, I don't object to that, although I would expect most of the people doing this would take the opportunity to move up and become LNAs, and, be a good opportunity for them to do it and at least make some money. So I'd be okay with that.
My only issue with that theory is that it could clog the position from people that would want to earn their LNA. If you had someone who stayed in it, said, I'm just going to do this, well, someone who might want to take advantage of that to get their LNA, the position's full.
Yeah, I don't know the chance of that, given there's been this chronic shortage, and so.
Representative Goley.
Thank you, Mr. Chair, and I'm glad to see the discussion coming around to the definition of temporary, which was one of my bigger concerns, because there is no definition. And I hope we stay on keeping this as a temporary health partner and move these folks up the chain to that shortage of LNAs we have. I guess I have one question, and I don't know if we can get help from Pam or anybody out in the audience. Is the term temporary health partner used in any other state and defined as to what it is, and that may help us on that end if it is being used. Thank you.
Help us from reinventing the wheel. Ms. Marling, are you aware of that? If that term is used anywhere else? See?
Sorry, I'm in and out of another meeting. I do not know off the top of my head, but I'd be happy to search and find out.
Appreciate it. Thank you. So real quick, I think, because I don't want to stay on this section forever. Do we all seem to agree that a definition of temporary would not hurt and for some of us actually help the bill? Just thumbs up. And would everyone probably support it then if we could get that locked down? Yeah. Okay. Go ahead.
If that's what the committee chooses to do, my preference actually would be to eliminate all references to temporary. But if the committee or subcommittee doesn't want to do that, then getting the definition in, I think, would be better than eliminating it, the whole thing.
Well, I know. I think, yeah, I prefer to have to get rid of it altogether would mean it was a permanent subclass of medical without the necessary impetus for going forward, I think. But I think if we could just keep it and define temporary to a reasonable amount of time, I think that it would still carry out the function of the bill, yet make everybody comfortable. We're not creating a position just to be paid less. Does anyone have an idea on the thoughts on the time period for a definition?
I had my hand up for a while, Mr. Chairman.
I'm sorry, I can't see you on the screen, but you go ahead, Representative Schmidt.
Thank you, Mr. Chairman. So just let's bring this back into the focus that this section and this idea is primarily for the benefit of the nursing homes, not primarily for the benefit of the people that are going to be employed. It is being driven by the fact that the nursing homes urgently, crucially need people to do these significant, important, vital tasks, even because they're, and Representative Lecca said it a moment ago, they're under supervision. So they're not being, put in as free agents here. They're going to be under supervision, but doing fundamental tasks that don't take a lot of training. They just take some guidance. So the temporary aspect clearly, in my mind, it has something to do with the pandemic. We're not done with the pandemic, no matter how much we would like to be. And as long as that's the case, we have to also take care, because one of the aspects of the pandemic is that you can have somebody who's in a job, whatever the position might be, who comes in contact, is exposed to the virus, and has to stop working for a couple of weeks. Unlike many other situations, they're kind of get a timeout. And so that makes the pandemic the underlying premise of this whole situation. And if you want to tie it into that, fine, if somebody can come up with language. But the other aspect of this that I wanted to address is we don't have to legislate every damn thing, folks, because once this statute is in place, then you're going to have rules written, and they can get into all kinds of details as long as the statute enables that. So I think we are, this is beating a dead horse in a way.
Well, the committee appreciates your input, Representative. But
I appreciate that, Mr. Chairman.
The pandemic is
Mr. Chair, as long as
second,
there
Representative.
was
Hello.
can you hear me?
Just hold on a second. I wanted to respond to Representative Schmidt.
I'm sorry.
The pandemic isn't mentioned in the statute, and it permanently creates the category of temporary health partner. So we have to contemplate well beyond the pandemic and the ramifications this would have going forward. So I agree that the pandemic is what the impetus of all of this is, but this statute doesn't contemplate just the pandemic that goes forward. So I think it would behoove us to have at least a definition of something that we're permanently putting in statute.
I'm not fighting the idea that a definition would be helpful, but what I'm saying is that the pandemic is, to me, is the driving force for this because of the fact that the pandemic constantly threatens a worker's ability to continue at that particular time if they've been exposed to the virus. Now that we have a vaccine that's showing itself to be quite efficacious, we can perhaps reduce the number of incidents of people having to take that time out. But the pandemic, I think, is the time frame that we're operating in. And I think continue if you can come up with a good definition. I don't have any opposition to that.
Thank you. Representative Pearson.
Thank you, Mr. Chairman. On the other computer on my desk, I've been doing research as to what might be called an underclass in medical providers. I've noticed that during a very bad emergency that we were under in this country called World War II, we ran out of RNs. And so there became a temporary group called LPNs, but they found that LPNs freed RNs to do more what RNs were trained to do. So LPNs eventually evolved into an honorable level of medical care. So even these temps we're looking at here, I would not want to see them as underclass. I would want to see them as another layer of helpful personnel that we need. And we don't just need when the pandemic runs its course. We're going to need them. We need them now. We needed them before in our county nursing homes and other places. So, LPNs started off the way this group is starting off, it seems, from what I'm reading on the screen.
I think we all agree that the position itself is worthy of discussion. I think we also agree that if we put a definition on temporary to get these folks to the LNA level as reasonably quick as possible, the better off everyone involved would be. So with that said, does anyone have an idea or thoughts on a definition of temporary for this so that we can move on?
Mr. Chair, I do see someone in the attendees list with their hand up, if that's something you want to recognize. Sorry, that may or may not be to the topic you stated.
Yeah, that's the concern.
I've also had my hand up.
Oh, well, you would go first, Representative Gordon.
Sorry, thank you. I think that it would, if we looked up the requirements for becoming an LNA, whatever hours, I have two thoughts. Number one, as long as we make this a stepping stone to something else, this is fine. If we create this position as an entry to the LNA, that's fine. I was for many summer jobs in LNA myself. And then the other thing is I'm concerned about how many of these LNAs how many LNAs, how many of these temporary health workers a nurse would supervise? Because as you know, we have a stressful situation with that group of workers as well. So I would want to make sure that we have a certain amount we have a limit on that supervision, how many, and if we want to do that in rules, or if we want input from the Nurses Association on that before we decide that, that's fine. I recommend that we would look at the hours of on-the-job training an LNA has and make it equivalent to that. So if they have the practicum hours that an LNA would have, that would be a possible way of defining temporary.
Can you look that up?
Yeah, I'll look it up right now.
I'm looking to see, does this statute have a rulemaking clause in it that would allow for rules to be made? First, let me see this person in the audience, if they're asking to help us out.
Mr. Hiltz has his hand up.
Yeah, that's who I've promoted. Mr. Hiltz, what did you want to contribute? Hello, Mr. Hiltz?
Mute, I think.
You're muted.
Sir, I did not have my hand up.
You did not, okay. Actually, you did, but that's all right.
Mr. Chair,
Stand by. Go ahead, Representative Stewart.
let me suggest it would seem reasonable to have the temporary time frame aligned with the amount of time that a normal process for licensure to obtain LNA would be considered reasonable.
I believe Representative Grote is picking that up right now, I think.
Yeah, I'm not sure how.
I can also tell you that the average salary in New Hampshire for an LNA is $19 an hour.
Again, I'm not sure how you would define the time period, but I'm sure there's some kind of standard that OPLC could provide.
All right, we're gonna move on. We all agree that we're gonna get a definition, and everyone seems to be in favor of once we can define this.
It's 2 hours, 200 hours, 2 hours, 200 hours.
Okay.
200 hours, and they also need the completion, a challenge. There's a test and a fundamental nursing course, which I do think that this would be a good discussion to have with OPLC. But I think 200 hours is a good number for temporary.
Well, that's only 5 weeks.
Well, that's what it is.
Yeah, I don't think that's going to fulfill what the statute contemplates. But I agree we should talk to OPLC.
Yeah. Are you saying that in lieu of training, we could extend the working hours towards the license?
Well, the statute proposed bill already contemplates somebody working for a certain amount of time in lieu of the necessary other training.
Okay. All right. So it would be, okay, I understand. So it may be 250 hours or something.
We'll get some from OPLC. All right, let's move on to the next section. Have any comments to start that discussion? I believe it's regarding the pharmacist assistance.
Isn't it on page 2, starting at line 11? Emergency licensing process.
Oh, yeah, I missed that one. That's correct. Emergency licensing process. Representative Pearson, thank you.
Not surprisingly, this was the kind of thing that would come up in Health and Human Services and did. And the only question about it that a couple of members raised was the idea that no required continuing education was mandated. But we all know, and I'm married to a physician, they can't stop reading stuff. So they read the journals even if there's no requirement. But we found that in an emergency, and that's clearly what this is, people who have let their license lapse, but there's no disciplinary action involved, would be helpful in emergencies. So this bill didn't come to us, but your chair did send it to me and said, read it over and talk it over with some of your committee people. And we're pretty good with this about licensing physicians from our state and from other states whose licenses have recently lapsed.
Thank you. Anyone on the committee?
Yeah, I'm okay with it.
Everybody seems to be okay with this. I'd like to see is the definition of emergency. This is only supposed to be done.
If you wanted to deal with that, if you really wanted it just under a declared state of emergency, it could say that under a state of emergency, declared by the governor or the legislature, which are the two bodies that can do it. But, which I think is sort of implied, but it could be clearer, I guess.
Yeah, I mean, it declares what emergency.
I mean, there's, RSA 4:, whatever, defines that. So.
Representative Pearson.
Thank you, Mr. Chairman. I would want a broader definition here. When I was 9 years old, two of the doctors in my hometown died, and one of them was away on the good ship Hope. And we dragged Doc Hilton out of retirement. He was 91 and sharp as a tack. We just dragged him out because we could. There wasn't anybody that said we couldn't at that time. The idea of hopping into a car, or more likely back then, hopping on the bus and going to the next city to find a doctor was probably not possible or likely. So the idea that in that localized emergency that lasted until Doc Goldman came back from his good ship Hope, and we secured another doctor for the town, it was good to have Doc Hilton available on a very localized emergency basis. This bill is written would allow for things like that. If it said it was a statewide emergency as declared by governor, council, legislature, some combination, it would eliminate that situation and its solution that we had back in Massachusetts in the 1950s.
If it was an emergency, it was left up to the medical board to determine with that.
Oh. Okay. I'm okay with that.
Do you think that would fulfill that, Representative Pearson?
I think so. Yeah, nowadays that's what we would do.
Medical board would be petitioned by the locality saying we have an emergency and can we invoke this statute?
Yeah.
Representative Goley.
Thank you, Mr. Chair. And I too, I agree that I think emergencies should be defined, and I think it should be a state of emergency or emergency declared by this legislature. As we all know, one person's definition of emergency is different than another person's definition of emergency. So I think there's a lot of very, very leeway in just leaving it as an emergency. I think the first reference to making a declared state of emergency is more suffice. Thank you.
Representative Goley, what are your thoughts on the example that Representative Pearson brought up as a locality has a shortage of doctors in their locality where the medical board would be able to declare a medical emergency to invoke the statute?
I just have concerns. Like I said, one person's definition of emergency is different than another's. And I think by leaving it very broad may defeat the purpose of what this part of the statute was intended for. I think we know of a lot of areas in the state where the need for healthcare, individuals have to travel a distance to get to the healthcare they need. And I don't think this is the solution to that problem.
Well, perhaps not, but it might help. And I'm not suggesting leaving it broad. I'm suggesting actually defining it an emergency as declared a state emergency by the governor or a local medical emergency as defined by the state medical board. And that would be limited to a shortage of medical providers in an area, and it would be temporary. Your thoughts on that?
I would have to read into this just a little bit further. I know some of this talks about nursing students and giving them temporary licensure 5 months prior to their graduation and stuff of that nature. We know there are shortages of nurses. Is that going to be considered an emergency for a hospital that they really need nurses? And we're going to be handing out licenses 5 months ahead of time. And that's my concern. When we all know that they should be graduating to get their license before they go into the medical field.
Thank you. Representative Schuett.
Thank you, Mr. Chair. point of interest on the previous question about the temporary health workers. I had reached out to the head of my county nursing home while we were discussing it. He was in a meeting, but he just got back to me. He's reasonably sure that those temporary workers did get the frontline stipend in pay that was put out. He unfortunately was not able to find anyone willing to work in that capacity at our nursing home, which I had thought that was the case, but I wanted to verify it with him. That was part of my question about interest in this particular category. And I think, as he stated, the lower tier of New Hampshire probably had a lot of folks interested, but from Merrimack County North, probably not so much. Thank you.
Thank you. Representative Pearson.
Thank you, Mr. Chairman. We spent a long time in Health, Human Services and Elderly Affairs Committee discussing underserved populations in the state. We had considered, we are still considering a bill that would license a graduate of a medical school with an MD or DO in his or her hand, but not matched for a residency program. And some of us cringed at that, because if you didn't match, either you didn't apply to enough places, or people, they got your number and they don't want you. And so we're thinking about either in some places having no doctor on hand, or having a nurse serve like a doctor, or having a retired person who is let his license lapse and wants to come back for a few years. And none of us is terribly happy with this. And we're looking at some alternatives on how do we populate underserved areas. And this is a big concern. And believe me, this isn't going away once this section of this bill is dealt with. It's going to come back in force in the next few years. As I say, we've discussed this in some depth and wish we could have fully, completely trained, licensed people in every slot. Fact is, we don't have that. So what is our fallback position? That's what we're really working through.
Thank you. Representative Grover.
Thank you. I empathize with Representative Pearson and the industry and the medical industry in the service of New Hampshire. However, let's look at it from the standpoint of the people that we're serving, right? We're underserved in almost every area, whether it be the medical field or the daycare industry, or there's many, many industries that we can look at New Hampshire and say, we could do something a little bit better. But we're also in this group passing legislation that affects the lives of people and their health. And I would not want to do anything. The concept of, well, someone is better than no one is not my idea of pragmatic or safe approach. So let's just take into consideration that although we have a need, we just can't throw bodies at the problem without thinking of the responsibility that we have to the people that are being served, who will trust these individuals, who will trust them like we trust our medical profession. Thank you.
Thank you. Representative Pearson, would you like to respond to that?
Yes, to respond to the representative, believe me, in a room full of physicians, including the former president of the New Hampshire Medical Society, we would not advocate throwing anybody at the problem. We would advocate throwing or placing someone who is a level down at the problem, at the people. Remember, doctors care a lot about people. Nurses care a lot about people. Medical health administrators like me care a lot about people. We wouldn't take anybody. In fact, during the pandemic, we rejected 2 people who applied for jobs here for the very reason. We would take a good quality person whose training isn't as high as we all wish it could be until we do some very serious work at how do we incentivize such people going to underserved areas? How much of their tuition do we pay? How much of their moving expenses do we pay? That's for the future, and we hope not very far in the future. But as of right now, as of today, no, not anybody at the problem, but certain specially vetted people who don't quite have the qualifications. That's really the conclusion that we are coming towards in Health and Human Services Committee.
Thank you. With regard to this statute, I noticed that all the licenses issued pursuant to this statute will expire on or before January 31st of 2022. So it looks like it's a temporary fix for the situation. Representative Gordon, did you wish to speak again?
No, I'm so sorry. I didn't put my hand down. Apologies.
That's okay. Representative Pearson? Does anyone else wish to speak on this section? No? Okay, now we will move on to the next section, pharmacists and pharmacies. We're moving on to pharmacists and pharmacies now.
Yep.
Anyone like to speak on this? Does everyone seem to be pretty okay with this? Allowing the pharmacy?
This is section 4.
Yeah, section 4, page 3. Anyone have any issues with that? No? Okay. That's good. I made up some time. Next session starts where?
It's line 28, page 4.
Out-of-state pharmacy. Sections.
That one is dealing, that's a separate thing, dealing with them. The first, section 4 was dealing with COVID tests.
Yeah.
And section 5 is administering COVID vaccines.
That's right, there's section 5. Okay, so the COVID test was section 4, and everybody seemed to be in agreement with that. Now let's talk about section 5, the pharmacist and pharmacy technician administering COVID vaccines. Does anyone have anything to say or any issues with that section? Everyone seems to be okay with that.
Yeah, my only comment would be, it's pretty narrow, and I'm okay with that. It's just if we end up with a variant that's no longer called COVID-19, then it won't apply. But
I think, aren't all the variants just sub-variants of COVID-19?
there may be, I don't know, but
Yeah.
I don't have any objection to it.
Okay. Representative Pearson, you wanted to say something?
Yeah, the next one may be called COVID-25. And while that is funny, it's pretty darn serious because we have no guarantee we won't get another COVID type in a handful of years. So I'm not knowing what I'm suggesting here and rename it, give it its generic wider term, but COVID-19, yeah, we'll be done with COVID-19, but the next one will be coming.
Yeah, it does seem that we're getting to this at the, hopefully what's the tail end of this and the need for it. But to your point, it would be handy to have, regardless of what the.
Right. I mean, I'd be okay making it administering any vaccine unless, but maybe there's reasons not to do that. But
Yeah, I don't know if that would cross too many lines.
Yeah.
Go ahead, Representative Pearson.
Thank you. This comes out of the counterpart committee in the Senate to mine in the House. And Senator Bradley was thinking more directly about what's right in front of us, not taking a position, not even thinking about what might be beyond. And yeah, emergency law is good, but if it's good for this, it might be good for the next one. And quite possibly the word COVID-19 could be replaced with a better term that I don't have handy in my mind right at the moment.
I just think that would be a better subject for your committee to take up in another bill because there's so many different vaccines with possible side effects that we wouldn't want to just blanket allow it at the pharmacy.
Yeah.
So
Similar issues with 4 for testing as well. It says COVID-19.
COVID-19. I would recommend that we just, we leave these as they are and just pass them and let them be used for the remainder of this COVID-19 issue. And if it seems like a good idea, it can be brought up in another bill to your committee.
This should have been, I think if some of these were not combined and were separate bills, they could have gone to Representative Pearson's committee. And
Yeah.
we're floundering because we don't have a lot of
This is our
expertise
area
in
of
this area.
expertise. Okay, moving along. Section 6. Mail order facilities, out-of-state pharmacies as temporary. Representative Pearson.
You're muted. Oh, he doesn't want to.
No, you're waving off. Representative Lekis.
Yeah, I mean, this is actually extremely limited. It's for them to be able to ship in drugs for people that are on clinical trials. And those aren't, I mean, I think this is good in general for that situation because, you know, that way you can get the drug sent here if it's appropriate. Let's say you're dealing with the trials down in Boston or even somewhere else.
To travel.
Yeah, I mean, I don't have any particular expertise in this area, but I don't see any problem with this.
Anyone else like to speak on this section? Seems pretty straightforward.
This is on the section on that, on the pharmacists.
This is the section on the out-of-state pharmacies temporarily being able.
Right, no, I'm fine.
Okay. All right, then, we're all good on that. Let's move on to section 7. The next section, if that's the name. You know what page it's on, Tony?
Oh, yeah.
This is on the construction workers.
I think so.
No, 7, I think this is the summer camp thing where if summer camp,
Okay.
they were grandfathered in, but they lose their grandfather, and if they weren't able to operate last year or this, last summer or this summer, I certainly support this.
Yeah, this is a common sense. This is just fixing what COVID wrecked. Anyone else have any comments or concerns about section 7 with summer camps?
No.
Okay. Let's move on.
Mr. Chair,
Yes, go ahead.
one quick one as I'm going through it right now. I just have one question as to, and I don't see it in here, and I don't know if we can get an answer. Does this piece of the statute, does this sunset? So, I mean, once this year is over, it should be, I don't think we need to keep this in place. I think we can sunset it once we're through the year amending it.
You're referring to the summer camps, right?
Yeah, that one is.
That's correct.
There are some prospective appeals at the end. I don't know if that one's in it. The pharmacy ones. Yeah, the emergent.
Yeah, correct. Representative Lekis, I think there are some repeals in the end that I haven't got to yet.
Yeah, there are for the emergency licensing procedures we were discussing a little bit ago. And the one we just spoke about, the out-of-state pharmacies temporary licenses mail order. Let's see. And also the expansion of outdoor dining. But I don't see.
Well, this section of the statute only pertains to camps that were not able to operate in 2020 and fixes the grandfathering issue. Whether or not the statute sunsets, it kind of automatically does on its own because it only refers to the camps that weren't be able to operate in 2020, correct?
Yeah, I think the only reason for maybe doing an amendment to have it go away after next year is just to keep the statutes a little cleaner.
Yeah.
And I'd be okay with that.
Okay. Would everyone be okay with that? Having this section sunset? Can you make a note of that for me, Tony?
Yeah.
All right. Anything else, Representative Boley? You good with that? If we sunset it?
I am good with it. I just don't think it needs to be kept on the books. Just make it confusing if we no longer need it.
Good point.
Yeah, the statutes are big enough as it is.
Yeah, they are. All right. So now we move on to section 8. Construction during COVID-19. Anyone have any comments or thoughts in this section?
I have some comments on this.
Please, Representative Grover.
So although it doesn't allow construction people to build without meeting the building codes of the towns. My concern is that in towns such as ours, where a significant portion of the town is because 65% of our town is wetland, we have strict buffer rules and to protect the marshes and the wetlands. And this is not unlike other towns that have their own conservation areas and are protecting them for environmental or wildlife or other reasons. So there's no what do I say? There's no repercussions for building something where it shouldn't be built and destroying our protected environmental lands. So I don't know how to incorporate that into this kind of legislation, but and although I empathize with that in small towns maybe the building inspector isn't available or the town hall is closed but somehow there has to be accountability for that as well.
Any other thoughts on this section?
I mean, if I could.
Yes, Representative Lefferts.
I mean, they have to send in the documentation. And there's nothing, if the municipal officials do respond, there's nothing to prevent that. I understand the concern.
Yeah, it does seem to let them just go on.
Right.
And that is anyone in the attendees from the municipal association or anyone who could speak to us about this? Raise your hand if you are. A little disappointed in the lack of, there we go.
As a previous chair, oh, sorry.
We're stuck in this weird spot. With
Margaret
this
Burns
bills
from the
that,
Municipal Association.
Unlike some of the omnibus bills.
Yes,
in other communities,
thank you. Go ahead, Ms. Burns, you're muted.
Thank you, everyone. Good morning, everyone. I admit I am multitasking and also listening to your work session here this morning. So which section have we gotten to here this morning?
We are on the section 8, dealing with continuing construction during COVID-19.
Sorry, page 6, line 25.
Yeah, page 6, line 25.
Can you hear me a little better now too?
Yeah.
Okay, good. Oh, I see. So this was a section which I'm sure you've already discussed here this morning. This was a section that was added when construction industry was concerned about being able to continue or do work during COVID when building inspectors and building officials may not be available to go on site or City Hall, Town Hall was shut down, things of that nature. So this was put in place to allow construction to continue, but also to put some parameters around it so that it was still being done safely and in good faith and all of those important things during COVID. I have not heard, my understanding at this point is that cities and towns, even if they are doing, some hybrid work, some remote work, or limiting the public in city buildings, town buildings, that they are relatively back to normal with these sorts of operations, doing building inspections. Certainly they're holding their planning board hearings and they're moving forward with things like that. I am not hearing that this is a concern that they need sort of the protection for. I don't know if the construction industry or any of those folks have a different perspective, but I am not hearing the same kind of concern I did in April of last year when cities and towns were concerned how they were going to help this happen with COVID, and especially in the beginning when we didn't know exactly what the right protocol was to keep people safe. So that's what I'm hearing, and I'm happy to answer questions. I apologize that I did not hear your earlier discussion.
No, that's fine. And I appreciate your input, Ms. Burns. Representative McGuire.
Mr. Chair, I just want to mention that during the hearing, I too heard that this was no longer necessary, that the emergency order worked for the period it was needed, and that by now it's not necessary to put it into statute going forward. So that was said by several people at the hearing, and I hope we can just delete the section and not have to worry about it.
Yeah, I tend to agree. Thank you. It's a couple sections in this omnibus legislation appear to be on the cusp of no longer being necessary. And this is certainly one of them. Unless there's anyone from the construction industry and the attendees that would like to weigh in, we will move along. Does everyone agree that this section, we could do away with it?
Yes.
Yep.
Yes. All right. I don't see any other hands raised, so we're going to move along. This was a long section. I'm glad we're doing that. Section 9, liquor licenses and fees, expansion of outdoor dining. Who would like to start? This one looks like it's going to have a little more discussion. Who would like to begin? Anyone have anything to say? No? Now, this is just for the Liquor Commission, correct? This piece of legislation?
Right. As I understand it,
I heard other legislation where there was discussion about outdoor dining in general that wasn't necessarily pertaining to the Liquor Commission. And it seems to me that the two statutes would have to operate in tandem, or they would be.
So RSA, what's RSA 143?
143A:4.
I forget what that is.
I'll look it up.
That's the existing one that.
Yeah, and the question is, does it touch on more than the liquor license?
Right. I mean, off the top of my head, I don't think the concern is going to be with the liquor service outside as much as it's going to be with the zoning in general outdoor dining issue, and that was dealt with in a separate bill. Anyone have any feelings or thoughts on this with regard to allowing the Liquor Commission to extend it? Go ahead, Representative Coley.
Thank you, Mr. Chair. I just want to bring up the point I think we heard from Environmental Services about expanding outdoor dining and some issues they had with that with those that are on septic systems. I believe this is a section they testified on.
I don't think so. I think this is only referring to liquor. I know what you're talking about because I heard the same testimony. I think that was in a separate bill. Was it 133 that would allow restaurants to open up outside, and it kind of ignored the local zoning issues?
That's correct. That was that bill.
Okay, Representative McGuire.
Bill 133 does not deal with outdoor dining. This is the section on outdoor dining that we had. And I believe the point we want to make is that this does not change any of the local licensing requirements. For example, if they have a capacity limit of 100 people, it shouldn't matter to their water sewer systems if those 100 people are sitting inside or out. And I believe that's what the option is doing, is allowing more people outside because they want to limit indoor air loading and allow people to spread out further. But the localities still have all the authority they ever did to limit the number of people in a facility.
Thank you.
And also,
Go ahead, Rose.
143A:4 is about a food service license. And later on in this section, it deals separately with the liquor license. But I think what Carol says, it still applies. Still the case, so.
Yeah, as long as the locality still has all the authority they originally had to limit. Go ahead, Representative Goley.
Thank you, Mr. Chair. The only other issue I had with this is I'm not sure why we need to go through to 2023 as we are seeing things are starting to open up again, and with the vaccinations and those COVID declining, I would think by the end of this summer, 2022, we should be all set to get rid of this temporary order, and not for all of next summer as well. I think this one should end through 2022, but that's just my opinion.
Only pushback I would have on that is that I'd like to not to have to revisit this if a new substrain pops up, and if we can give ourselves a cushion. I don't know that it would necessarily hurt to have it in there until 2023. But I understand your point.
Yeah.
Representative Lekis?
Yeah, I agree with you. I mean, I certainly hope, I'd like to believe that we'll be done with it by the end of the summer, end of the year. But you know, that may not be the case. So I'd be okay. I mean, I wouldn't object massively or eliminate it to the end of 2022, but I don't have a problem letting it go through 2023 either.
Unless there's a reason other than just to keep the statutes clean, I would prefer to leave it to 2023, just so we don't have to revisit it again if there's an issue.
Yeah.
And if everything works out and it's all clear, they're going to probably not utilize it anyway. Representative Groda?
Thank you, Mr. Chair. In my notes, Margaret Byrne did say that although it does recognize local control, she felt that more clearer language was needed. So I'm going to follow up with her on that, unless I believe she's still here.
Ms. Burns, would you be willing to chime in on this?
Yes, of course. Yes, that is what I discussed at the hearing, that the understanding has been under this language in the governor's emergency order that clearly local rules and regulations do apply, and that this language was meant to deal with the state level licensing, allowing for the outdoor expansion under that statutory scheme, but that all normal local rules that would apply to, building out or making changes in a site, or building out into the road or on shared property in a parking lot, all of those normal rules would apply. And so my suggestion had been just a few words clearly saying that, local rules and regulations still apply to the expansion of outdoor dining. And after the hearing, I did speak with Darren Winham, who is the planning director and community development director over in Exeter. He is the one who actually drafted this language for the emergency order. And I do believe he is here with us on the call this morning. So if the subcommittee would like to hear a little bit of background from him on why this was written and what it was meant to accomplish, I believe he's here with us this morning.
He is, and I have promoted him. Mr. Winham, could you please let us know your thoughts?
Good afternoon. Thank you very much. And thank you, Margaret. I wrote the legislation, but it was with the assistance of Mike Summers from the LRA and Warren Daniels from the SPDC and a lot of other restaurants that are worried, and just to address a couple of the issues. The first one is the reason we put it through 2023 and we originally wrote it through 2022 was because of the fact that these restaurants are hurting so much. And we want to give them the confidence that they can actually, have outdoor dining for long enough that they are willing to make investments and, just be as healthy as they possibly can be. Addressing the environmental issues, Margaret's absolutely right. The way the legislation is written, as I understand it, is that, we have complete control over that. The towns have control over that. Now, whether that's on private property or on public property. And it's actually written so that if one has, this is the liquor portion of it, in order to serve liquor outdoors in areas that was not already approved by the Liquor Commission, they have to have the actual Liquor Commission license. So in other words, if a restaurant doesn't have a liquor license or for outdoor dining, they can't just get that anyway. And the last piece is the way most towns do this. The town, of course, has to approve it, as you understand, but then most processes are like ours. There was about 6 of us towns that got together and sort of wrote the drafts for it. And that means one applies to the town, the fire police, planning, DPW, health, everybody has to sign off on it. And then they get the final signature. We require $1 million of additionally insured if they're on our property. And that's about it, but it's a very buttoned down process. We require a sketch and all the department heads to go see the space and everything. So very much appreciate you guys taking this into consideration. You're going to help a lot of people, a lot of workers by doing it.
Thank you. Does anyone else in the committee have any thoughts or questions? I think I like this the way it is. It leaves local control, but at the state level, gets rid of barriers that are in the way for the restaurants. Representative Schuett.
Thank you, Mr. Chair. I was curious, Rob Tardif from DES had testified during the original hearing, and DES's concern was lack of, how shall I say, restroom facilities to accommodate possibly more clientele. I'm curious if Mr. Tardif, someone from DES, is present.
I believe we just addressed that at the beginning because their occupancy limitations would still apply. So whether they have 100 people inside or 100 people outside, their septic should be designed for their occupancy limits. This doesn't waive their occupancy limits, so that should not put an additional strain on there. But Representative Gold.
Thank you, Mr. Chair. I think I'd like to hear a little more on that because I think occupancy deals with the inside occupancy when you get your certificate of occupancy. And when you expand outdoors, that number can be increased because of the square footage of area you are now using. But I would like clarification on that, whether I'm correct or not.
Mr. Tardif, you're able to unmute yourself and speak.
Okay, I'm sorry about that. I think, am I in?
All right, go ahead.
All right, thank you. Thank you, Mr. Chair and members of the committee. Again, my name is Rob Tardif. I'm the administrator of the Subsurface Systems Program in the Department of Environmental Services. In general, we deal with on-site wastewater or septic systems. We deal with other things, but relative to this conversation, I just want to preface what I'm going to say with, we only deal with those, in this case, those restaurants that are on septic systems versus those restaurants that are on municipal sewer, for instance. So anybody that's on municipal sewer, we have no authority or any input on that. What our concern is a lot of these properties that that these restaurants are located on have been, the number of seats have been maximized to what the lot can support and sewage load. It's a relatively simple formula. I mean, it takes into account different site characteristics, whether it be wetlands, an on-site well radius has to be deducted from this particular formula. You plug all this information in, and this formula will essentially tell you how many gallons per day a lot can support in sewage load. And the way we regulate restaurants is on a per seat basis. So, an approval issued by the Bureau may be for a 50-seat restaurant because that's all that lot can support. So our concern is to just allow for additional seating. You may get into a scenario where the lot can no longer, by this formula, support that sewage load. The other concerns we have is the existing system is designed based on a particular sewage load. And if what I'm hearing this may not apply, but I'll just finish my thought here. If you add seats, if you have 100 indoor seats or 50 indoor seats and you want to add 25 additional seats outdoors, now that system is no longer built to accommodate for that additional load. It's not just the leach field that we're concerned with. We're concerned with the septic tank not being able to separate the sewage as it's designed to do. In addition to the septic tank, there are also grease traps. And these grease traps are designed at a particular volume to address certain grease loads. Again, you start accommodating for additional seating, all of that sewage load and grease and everything else is increased, and it could be increased to a point where it could cause premature failure of a system. And another concern we have is it may be one thing for a standalone restaurant. I own, Rob Tardif's restaurant on my own piece of property. And if I add additional seating and I fail my system, then it's kind of on me to address that situation. A lot of these, there are a number of these restaurants that are in, somewhat of a condominium, a commercial condominium type scenario, where somebody may be the owner of this commercial condominium, one of his or her tenants is a restaurant. So now that system, which is designed to accommodate for potentially a number of different types of storefronts, including a restaurant, that restaurant may now be allowed to increase that sewage load, which could detrimentally affect the system for the entire commercial condominium complex. We're concerned with, the logistics of how this is going to happen. What state department is going to be delegated, I guess, to keep track of these seats, and if and when this gets sunsetted, how are those seats then going to be removed if they're going to be removed? We have existing compliance. I can stop at any time. I don't want to take up too much of your time. One last thing, if I could, is we have existing compliance cases regarding expansion of restaurants, and what would happen to those existing compliance cases. Would those compliance cases then be, removed from concern? So anyway, again, I don't want to go on and on, but the department does have some concerns that maybe should be discussed within the committee.
Thank you. Just briefly, if a restaurant has a seating capacity, and we're talking about indoor seating, that seating capacity would be matched to the existing sewage system, correct?
That's correct.
So if this bill were to limit the outdoor seating and indoor seating combined to what the indoor seating would be, would that alleviate the problem?
We would have no issue whatsoever. We were under the impression that this was going to allow for additional seating. As a matter of fact, I'll be brief again, but we have worked with restaurants, and we work very closely with food service licensing and health and human services. And we have said to people, absolutely, bring your seats outside, but you would have to somehow cordon off those indoor seats as to not increase the sewage load as a result of bringing seats outside. If the number of seats don't increase, the Subsurface Systems Bureau has no concerns.
Thank you. Representative Lekis.
Right, that's what I was going to suggest, except it should say they can't have any more seats than currently permitted for indoor and any pre-existing outdoor dining, because some restaurants have had both, but they may have expanded the outdoor. But I mean, an amendment like that seems like we'll take care of these concerns.
Where did we lost? Mr. Wynnum, please.
Thank you very much. I certainly appreciate what Mr. Tardif was saying, and I frankly agree with it. Could you possibly have it written such that, and I would love to have Mr. Tardif weigh if it's okay, have it be that if it's on a septic system, the way you're proposing it makes a lot of sense. Whatever the maximum seats are indoor and out would be the maximum seats forever, or going ahead till 2023. And then if it's on municipal sewer, since it's under municipal control, we could allow them the extra seats that it could be accommodated.
So that suggestion sounds right to you, that we just limit it to the number of combined seats, what the indoor seating would be.
If you're on septic, but if it's on municipal, then allow more seating if the town allows it, because that's gonna be by zone and by,
Representative Grota.
Right. I want to be sure that one of the things that's important about this legislation is it does allow for local control, which is something that I want to maintain. So if we put the legislation, I'm just wondering if I agree with what Mr. Tardif is saying, that the total number for those restaurants who are on septic has to remain the same as if the indoor capacity has to equal the indoor and outdoor capacity. And for those systems that are on sewer, local, I think we should say that local ordinances, local, whatever it is, local law applies. I think we need to say that for both, so that people who are on sewer systems understand that they themselves have to follow local rules as well. Does that make sense?
It does. And Mr. Wyndham, is that not already contemplated in the bill that at the end of the day, the local authority?
It is, sir, but I think what Margaret and what Representative Grote are saying is that it needs to be, I think, more articulated better. When I wrote it, I don't think I wrote it as well as, frankly, it could have been.
Okay. Representative Grote, would you be willing to get us some language that would fulfill that? What you're
Yes.
looking-
Yeah. If Ms. Burns and Mr. Wyndham and Mr. Tariff will assist me, I'll be sure to get that to you.
And we want to, so we want to put it so the max capacity then is the indoor capacity. So if they go outside, they can't exceed the numbers if they were all inside. Does that make sense? I've said this too many times. I'm probably not.
Yep, I'll take care of it. Yep.
All right, thank you. Representative Goley, did you want to add something?
No, I just want to point out that it would be good to have local control still in the mix of it, because it only states that if an expansion is in a shared space, such as a sidewalk or street, then the restaurant shall be required to coordinate and seek approval from local authorities. It doesn't say anything about parking areas, and I think that's an important issue as well in local communities. As you take away parking spaces and you increase outdoor seating, that increases the number of cars coming in, and those cars have to park somewhere. And if those spaces aren't there, it can become a problem on local streets. So I think it is important that local communities also have a say in the expansion.
I think they should have the final say. Mr. Tardif?
I just want to quickly add that I would be more than willing and happy to help write any additional language to this. I just want you to know that I'm on vacation for a week. I'll be back next Thursday. I'm leaving tomorrow, but I'll be back next Thursday. And again, I'd be happy to help.
I appreciate the offer. Representative Grote, you might want to take advantage of him today if you could, because I don't think we'll be holding on to this that long.
That's right.
All right. Does anyone else have anything to say on this? We're all okay with it if we fix the septic issue and the local control issue. And that, just I want to recap before we move on to the amendment. So the first section, a definition of temporary. Everyone said that we would be okay once we define that. Is that correct? Section 2, emergency licensing. Where did we end with that?
You were talking about putting something in about it being up to the medical board.
Yeah, we didn't really clearly complete that, but I think that we wanted the definition of emergency. And there was some discussion of it being the declared state of emergency, but also allowing for a local emergency for lack of medical professionals as defined by the medical board if they were to make application to them. And if I recall, Representative Goley wasn't exactly thrilled with that idea. Any other thoughts?
Mr. Chair?
Yes, Representative Schuett.
Didn't, if memory serves, and it's been a while now, didn't Representative Pierce say that his committee was grappling with this subject?
Yes. Well, I think
I'm wondering if there's some way that we could defer this section to his committee, which probably has more expertise towards it than we do.
I'd have to look. Actually, one of the things is Yeah, so section, which section?
Section 2.
Okay, so section 2.
If it sunsets, then we should just do it.
Mr. Chair, if I may.
Yes, go ahead.
My concerns are alleviated, seeing this is going to sunset January 31st, 2022. This is just temporary, and as long as it sunsets on the January 31st, 2022, I'm all set the way it's written.
Yeah,
Okay, so we'll just leave it alone, and if they want to address it further, they can take it up in Health and Human Services and another statute. All right, so section 2, we're good. Section 3. Pharmacists and pharmacies, I think we all agreed that that was fine.
Yeah, and I think that's another one where if it needs to be expanded beyond just COVID, leave that to the other
Yeah,
committee.
we're only going to deal with stuff that sunsets, and that COVID covers. Everything else should appropriately
So
go to the
that's-
right committee.
that's part-
in the new statute. Section 4 is the same thing.
I'm not
right?
sure if that does, well, that sunsets. Problem is, it's hard to, some of these sunset based on the M and some kind of do themselves.
4 was testing. We agreed that was fine.
Yeah.
And it talks about COVID-19, so it sunsets. Section 5 was vaccinations.
Yep.
And we decided to leave that alone with COVID, and anything else if they want, they can do in the legislation.
Yeah. 6 sunsets as well.
6 sunsets as well, and that's for pharmacies out of state. 7 is summer camps. We agreed that that's fine.
Yeah.
8, construction.
We were talking about removing that.
We were talking about removing this section.
Mr. Chair,
But go ahead, Mr. Representative Goley.
just a quick one on the summer camps. Can we look into whether that should sunset or not? That was the other discussion we had on that one. That's the only one.
Yeah, I mean, it's sort of, it's limited duration, but it would still stay in statute if it doesn't sunset. So yeah,
Okay, so let's,
that'd be good to do.
let's
Yeah.
add a sunset to that, and then we all agree with it, correct?
Correct.
All right, section 8, the construction one, I believe we discussed removing this.
Oh, well,
Go ahead.
one other on the summer camps. I think that someone ended up talking about this before, and adding 2020, if they were closed 2020 or 2021 due to COVID. I mean, I'm hoping that's not going to happen next summer, but there was talk about, including 2021 just
You mean
in
this
case.
summer?
Oh, actually, wait a minute. If they were closed because of COVID last summer, and we could add this summer just in case. But it says COVID-19, so it would have to be because of COVID-19.
Yeah,
If we're going to amend it anyway, I would suggest doing that.
just add this year, just in case.
Yeah, the summer of 2020
Does
or
anyone else have a problem with
2022.
this? We're going to add a
2021.
sunset for it, like you suggested, Representative Goley, but we're going to also include 2021 in case the summer camp can't open this year because of COVID as well.
I'm fine with that.
Else seem okay? All right. Section 8, we heard and agreed that this is no longer necessary. No one's here from the construction industry to counter that, so everyone agreed to strike this portion. Okay. And portion, which is good. So then that brings us on to section 9. Representative Grody, you're going to get some language, and we all agree that the language will limit the capacity for the sewer systems to the indoor total.
Mr. Chair, I have a question. So when you say if everyone's okay with that, is that our version of a vote right now?
No, I'm just trying to make sure there's no. Before I put,
Okay, sorry. I'm actually
if
in
you
a
have,
place where it's not always easy to hear, but I just wanted to make sure I didn't miss a vote.
no, we're just trying to make sure there's no more work to be done before we vote it out of the subcommittee. And if you have an issue with anything, speak now, please. And so we agreed on the language in 9, which I guess, so we're all set on that. So I guess we do have to take a vote.
Mr. Chair,
Yes.
just a quick question. Just a reminder for Representative Grota when she works on the amendment for outdoor dining. I think we had agreed that the appeal date on that should be moved up also. Should she include that in her proposed amendment?
Did you bring repeal?
There was discussion. And some people wanted it moved up and some left through next year just in case.
Yeah, I think we were going to leave that through next year just in case to get, we heard from testimony that it would add some surety to the restaurants as far as planning and things. If they knew for sure, they'd be able to continue this regardless of what happens for one more year.
Right. Well, it currently, if I'm correct, that is referred to as December of 2023. So the suggestion was made to make it December of 2022.
Right, but we agreed that, well, it was recommended that we leave it the way it is for 2023.
Yeah, just so that the restaurants would have, whether or not they have to utilize it, it lets them plan and know that they're going to be able to use this if they have to. Representative Goley, you have a question?
Thank you, Mr. Chair. I'm still just have concerns going that far forward. We're giving them 2021, all of next year, 2022, and then we're looking at, this adds on that third year because this doesn't end until December 2023. That's 3 summers out. I think 2 summers is good. If we need to expand beyond that, we have the ability to as needed. That was my only concern. I mean, this is going way beyond what I believe is needed.
I'm open either way.
I believe that once the restaurants have this ability approved, that they're going to look at having this outdoor dining possibility like every summer.
Which may be a good thing. That's not what this bill. So does anyone have an issue if we bring it to December 2022?
I'm okay with that.
And if it looks like in the fall of 2022 that some amendment will be necessary to extend it, like Representative Goley said, we'll have plenty of time to do that. Okay, can you get that, Representative Broda? Just amend, change the sunset to December 2022 versus December 2023.
December of 2022, will do.
Okay.
So as far as the process here, I know certain people are taking on certain parts of it. Are you looking for someone to do other parts of it, or what's the process?
I think we've got everything except for, well, I need, if someone could take on the definition portion if you want to do that.
For temporary?
Yeah.
I won't do that. I'd like to get rid of it. But if you need somebody to take on the summer camp one, I can do that.
Okay.
Easy enough.
All right. We're not going to vote on this until we have the amendments. So I'm going to see if I can get us another subcommittee meeting shortly, because I can't. How can we vote on it without the language changed? I mean, unless we did a conditional vote based on what we all agreed to. Representative Goley, were you going to say something? I saw you reaching.
I just was wondering, and this might be a question for Pam. I think as each of your subcommittee members are working on amendments to certain sections is a good thing, but I think we will need a full final amendment to amend the whole bill after we get those initial subsection amendments done. And I just want to make sure that the committee's aware of that as well.
Maybe we can send these to Ms. Marling to compile together, so we'll have one amendment to change the bill.
Absolutely. I was going to chime in also, Mr. Chairman. Thank you. I would be happy to, compile and look into the definition of temporary health partner in other states and see if I can find some kind of definition that will be helpful. But in the meantime, as you work on your various pieces, if everybody would be sure to send them to me, that would be great.
Thank you.
If I get a further question on process from Ms. Marling. So should we send a request for amendments to OLS and then you'll merge them all together, or just send you something indicating the changes and what we think the language maybe should be?
I think it's easier if we just go to OLS once, if possible. So if you just send me your sort of informal language, clear, but not necessarily OLS drafted, then I can compile it and send it to them and then review what they send back to make sure everything's been incorporated, and I think that's easier in the long run.
Okay, I think we got it. So also, if Ms. Marlin, if you could, I'll be the one handling the definition of temporary. So if you could get me what you find out on that.
Sure, sure.
Representative Schmidt, do you have something to add?
Thank you, Mr. Chairman. Well, yes. First of all, you guys have done a lot of very good work this morning, so congratulations on that and well-run meeting. But the proposed amendment, of course, is still hanging out there. It obviously, if it doesn't go anywhere, then the process you've laid out will wind everything up successfully. But clearly, depending on where we go with the amendment, or you go with the amendment, we're going to have to, nothing can happen with regard to 155's final form until that's resolved. So,
I was going to take up.
You're going to break for. You're going to go right to.
I'm going to go ahead on with the amendment right now.
Okay, thanks.
Run out of time, and we've got the executive coming up at 1 o'clock.
I mean, the only other option, if we're going to have another subcommittee on 155.
We mean address the amendment. I'd like to at least get started on the amendment and see where we land. Okay, so everyone have the latest amendment proposal 2021-1334H. Everyone have that? I guess everyone does. I'm not seeing anyone say they don't. So let's open it up for conversation. Who has anything to say about this? Who wants to start?
If you're still there, I think Representative Baxter was going to say something about his amendment, if that's all right.
That'd be great.
I don't know if he's still there.
Yes, I'll go to now. Okay, Representative Baxter, you're live. Just unmute yourself.
Thank you, Representative Roy. I am still here, and I really did enjoy that conversation about SB 155. I may want to answer some questions as they pop up by members on the committee, but I did revise the amendment slightly, and the biggest change is the exemption provision. I really took the feedback seriously from the last time when people were testifying, and the exemption provision was probably the area where we received the most constructive criticism. So that section has been broadened to deal with just really medical facilities as a whole. For an example, we saw someone from a nursing home that talked about, we don't force our employees to get the vaccine, but we need to know who has the vaccine so we can make proper decisions for the people we're serving. And I thought that was a very legitimate criticism. So we've taken that feedback and changed the amendment. So now that exemption provision is broader. The substance of the amendment overall is still the same. It's still a bill that's making sure that the state of New Hampshire or businesses that receive taxpayer funds don't force employees or their customers to get a vaccine or to require a vaccine passport. And if they don't do that, then they could possibly be discriminated against. So the substance of the bill is the same. And if anyone has any questions, I'm happy to answer anything right now.
Anyone have any questions for Representative Baxter or wishing to comment on the amendment? Representative Broda.
How do public schools fit into this amendment, Representative Baxter?
Thank you for your question, Representative. So public schools, because they're subdivisions of the government, they fall under that. So UNH, for example, this was asked last time, they would not be able to require a vaccine to their students or require a vaccine passport.
Do you have a follow-up, Representative Gordon?
No, and I will tell you that I will not support this amendment.
I also will not be supporting this amendment.
Well, it's nice to see everyone is so open-minded that we can't even have the discussion.
I do believe that schools are an important component of this, and I'm sorry if this appears to be closed-minded, but it is a very important point to me, and I am offended by that comment.
Representative Schuett.
Thank you, Mr. Chair. I've had some conversation with constituents in my two towns, and the consensus seems to be that they don't feel that it should be mandated that people show evidence of vaccine, but they also do not feel that it should be totally banned. I think my personal feeling is we should just leave it alone. Leave it up to businesses or entities what they feel they need to make their employees or clients safe.
Thank you. Representative Lekis.
Thank you. Yeah, I've talked with other people in our district, and I mean, the issue is by saying that people shouldn't have to have an invitation showing that they've been vaccinated and they shouldn't be forced to it. I mean, the question is, when people say that, what do they mean? You know, if a business wants to require employees to be vaccinated, I mean, does that mean they're just going to ask them and they'll answer and take that at face value? And if a business doesn't want customers in who haven't been vaccinated, you know, if there isn't going to be any document showing you've been vaccinated, what does that even mean? I mean, I'm going to support this. I would actually support it being broader, as has happened in some other states that don't just limit it to businesses that take money from the state, but it applies to all businesses. But I mean, I'll accept this as an acceptable compromise. But the key is, if you're going to allow a business to demand that their employees or their customers be vaccinated, I mean, that doesn't mean much unless people have to have some kind of documentation showing it. It kind of implies that you're going to have, you know, a vaccine passport or something by another name that's really the same thing.
Which is prohibited under this.
Right. So, in a sense, I mean, you could argue that if, you know, that this actually should apply to everything, but, you know, it is limited somewhat, and I'll accept that.
Representative Legro.
Yes, thank you. I second what Representative Lekis said. Look, regardless of where you stand on this subject, no matter what persuasion, political or otherwise, that fits you, there's no denying that this was a highly politicized circumstance, we'll call it, for the past year. And with that fact established, forcing individuals, and it is forcing them to have a bioactive compound injected into their flesh or face societal consequences, and that's what will happen. It's an unbridled attack on our personal freedoms. This is the most important tidbit of legislation that this committee is going to consider all year. And I could see it now. You can't have that job. You can't dine in this establishment. You can't fly out of this airport. Where were your papers? So regardless of complications, and I understand there are complications, specifically in the medical field, we can't provide the means to sort people like cattle. So I support this amendment, and I support broadening it.
Thank you. Representative McGuire.
Yes, the amendment, but I am actually popping in to request that, considering how things are going, that you schedule another work session on this bill before our planned exec session on next Tuesday. If you announce it what day you choose at this meeting, you should be able to, you won't necessarily need to put it in the calendar, because I believe all the interested parties are here.
You said it, you'd like it to be before next Tuesday?
Yes, Thursday looks pretty empty.
Is everyone available Thursday to do a second work session so we can finish this up?
I am.
Yeah. Okay. So we'll schedule it for Thursday morning just to wrap everything up, and hopefully we all have our assigned pieces of legislation back. Okay, thank you.
I
Back
did want to have a chance to speak on that bill, if that's something you've moved on from.
No, you're talking about the amendment?
The amendment and the bill, but the amendment just expands the bill, right? Can you hear me?
Yeah, go ahead, Representative Schultz.
Well, I just want to say, first of all, there is no vaccine passport. That is a word that is loaded and nothing anyone is asking for. The second piece, to expand, disallowing requiring a vaccine. I don't think we should be telling any institution or business what they should require. It's ironic because I believe it's on wedding cake. You cannot tell a business bakery they have to be able to make a wedding cake for a same gendered couple. This would actually be the same. We can't tell
Representative Schultz, you're coming in and out. I'm only getting like a quarter.
all businesses or institutions, as far as I understand it. It actually, okay, how about, is it better this way?
It's just,
Can you hear me better now?
yeah, so far you haven't cut out again, but I go ahead.
Well, just one more thing I wanted to say about it, and that is, it actually very well may hinder business, because if it is a tourism-related business that wants to ensure safety for those who have been reluctant to travel, the ability to require a vaccine, say if we were to have a port in Portsmouth for a cruise ship, or buses from cruise ships, or which does happen, by the way, from Boston and Portland, or any other type of business that wants to ensure the safety of their employee. Our opinion is about the vaccine. If a business has decided that's what they need for the safety of their employees and their customers, that shouldn't be something, ironically, that we should want to do. I just find it ironic that our values about the free market change when we have a personal opinion over a vaccine or an illness, which, by the way, none of us are healthcare providers to have an opinion on that. But
Constitutional rights.
Okay. Thank you, Representative Schultz. I think we just lost you again, but I got your last statement.
I was finished. Yeah, thank you.
Thanks. Let me see. Committee members first. Representative Grota.
Are we going to continue, or are we going to do lunch?
Oh, actually, it's 12 o'clock or
1 o'clock.
No, it's 12. You have to 1.
Mr. Chair, I will hold my question until we meet again. It's fine. If there's no issue.
Yeah.
For me, we can certainly break for lunch.
Ready to 1.
Can I interject briefly, Mr. Chairman, just before you all go? I understand as I understand it, you're talking about Representative Baxter's Amendment 1334, correct?
That's correct.
And I just want to point out that it amends, and maybe you talked about this and I missed it, but it amends Section 6 of the bill relative to the pharmacy language, and also Section 9 of the bill on the expansion of outdoor dining. And I just want you to keep that in mind as further amendments are discussed to either of those parts.
Does this amendment alter those?
Yes, it does. So if we're thinking about adopting it, as 1334, we just need to remember that those sections appear. And if you want to do something different with the expansion of outdoor dining, potentially, we need to get a new amendment that only addresses the vaccine Anyway, just to keep it in mind, keep it in play.
No, thank you, and I appreciate you keeping on.
Just a process question. What I thought was that if the committee votes to adopt this, as well as another amendment, dealing with various parts of SB 155, that the end result will then be merged together in one amendment, just like we're doing for 133. And so there really only be one amendment in the end. Is that not correct?
That's what our goal is, to have one amendment, but I just wanted to make sure that, if you adopted 1334 and then you adopted something that Representative Grota put together that amended the expansion of outdoor dining, they would potentially conflict. So I just want to make sure that we adopt, one change to each section.
We don't have to, as a process, we don't have to adopt this proposed amendment. We can just adopt the language we want.
Right. I mean, you'll fold this into the final big amendment. And if you say, let's not deal with the expansion of outdoor dining portion of the Baxter amendment, let's let Grota, Grota's language take precedence. That's fine. I just want to make sure I understand what you're going.
No, I understand. So we will look at that and make sure that. Did you get what I discussed with Representative McGuire as far as a further subcommittee on this on Thursday morning at 10, if possible?
I did hear that. I will be in another committee at the same time, so it makes it difficult to listen to both. But that's what I've been doing today too. So.
But is that available for us to use?
I don't know. I'm not the person in charge of the licenses. You have to get permission from Aaron Goulet.
Okay. All right. Thank you. Let's just wrap up real quick for this one. I want to give everyone a chance to speak on the amendment with regard to the vaccines, because after this, we'll probably just vote on it at our next meeting. I don't want to belabor it. Representative Grota, did you already spoke on the vaccine amendment portion, correct?
She said she'd defer.
I said I would defer. But I also want people to know that I'm not agree. I don't support mandating vaccines, but I support local control as to what we do.
Okay. All right. Thank you. Representative Schuett.
Thank you, Mr. Chair. I will just point out that we do have an interstate airport in this state. I don't see how we could possibly mandate to Southwest Airlines whether they feel they need to ensure that every customer that comes on their plane has vaccine, since they're flying to other states that will mandate that. I know for a fact they have been requesting proof of testing previously. I haven't flown recently, but I believe that that's probably what's coming. So I don't see how we can do that with an airport that obviously flies to other states and possibly other countries.
Well, without addressing the sentiment, I can tell you that having just come back from Florida on Southwest, they required nothing other than a mask. There was no request for vaccinations or anything like that. Representative Schmidt.
Thank you, Mr. Chairman. So I understand that we're up against the 1 o'clock schedule and for a break for lunch. So in my view, there are several aspects of this proposed amendment, the new one, the new variant, that are completely unworkable. Some would be in violation of federal statute, I believe. Just reminding that we cannot bind a future legislature. And so to the degree that we are proposing to ban something which is not on the table, vaccine passports are not on the table. State or government mandates of vaccination are not on the table. So we might as well include, flying pink elephant or unicorns as well, in terms of the workability of this amendment I will speak to it at length when we have an opportunity. But you're intending to take this up at 10 o'clock on Thursday morning again, Mr. Chairman?
Actually, no, the next time you'll be able to speak about this will probably be in the full committee.
No, I thought we were having a subcommittee work
We are,
session.
but I want to not this, I mean, we know how we're going to go.
I'm sorry, we can't hear you, Mr.
Yeah,
Chair.
could that be repeated? I couldn't make anything out of it.
That was a sidebar. I was just. So Representative Lex, have you had a chance to speak in on this?
I don't recall. I mean, all I'll say is that the word vaccine passport may be loaded. I'll admit that, but if we're going to permit, I mean, if there's going to be a requirement, either by the state or by private businesses, in effect, you create something like a vaccine passport, whatever you want to call it. And certainly, if it ever is required to fly, then it's basically what it is. The only thing I'll say is there are more than one state that have already passed a law completely prohibiting any business from requiring it. And I don't know of any state that doesn't have an airport that has flights out of the state. So, there's going to be a larger issue there, and there's going to be some accommodation to it, I believe. Anyway, I mean, I think it could be a larger discussion, but.
Right. So was my question. Are we further subcommittee meeting at which this will be thoroughly vetted, because we haven't done that at this time?
We will, whatever's left to be done at the next subcommittee meeting with regard to this, we will.
Okay, so that's going to be on Thursday morning at 10 o'clock, Mr. Chairman. That's what I'm trying to determine.
That's correct. Although I don't want to spend an inordinate amount of time on an amendment that we already kind of on as far as voting. I'm going to close this meeting myself with my final comments. I think that the state of New Hampshire has a tradition of personal liberty. I would be against any mandated immunizations, any mandated records of immunizations, or any government or private entity demanding proof of immunization. I think it's, we say that we're ironically picking, what we want to interfere with. Well, this is a constitutional right to privacy that the people of New Hampshire just voted on in the last election, that they hold their privacy to be very dear to them. And you cannot get any more private than someone's medical situation. So I think that the Constitution of the state of New Hampshire supersedes that. So I will be voting in favor of this in some form or fashion as we delve into whether or not any amendment to it is necessary. So with that, I'm going to close this hearing, and I will see the members of the subcommittee again on Thursday morning at 10 o'clock after we, hopefully, if we get this Zoom stuff sorted out for that time. And with that, we're going to go ahead and close this subcommittee meeting. And everyone, please remember that at 1 o'clock, there will be an executive session. We'll be picking up again on 133, I believe. Thank you all very much. And
thank you.
Thank you.
Ms. Smiling, if you could meet the room, or we'll do it. You going to do it?
Okay, I'll let you do it. I'll post a notice.
Video's on. It's on you.
No, I'm going to just use the speaker. Here is my speaker.
There you go. Problem is, mine wasn't working over there.
All right, thank you. I'm not going to use my computer.
Real technical problem solving. You want to check that.
Usually much the same.
Sparling, can you promote me?
Sure.
We are short a few members of the committee.
Pam,
Yes.
what I'm going to do, if it's okay with you, is to continue the process of committee work session and write up a separate committee report on each subsection, put them together so you have separate items. Each
That
one,
makes sense.
each section is separate.
Makes
Okay.
sense. Yeah, since we only have, 4 sections that haven't yet been addressed. And
Okay, well,
just add it to the previous.
I guess that's, yeah, that's the way I was doing it before and.
Right.
All right.
Great, thanks.
Who do we have here? Oh, there you are. Representative Pearson's here. It's on the phone.
And while we're waiting for people to settle in, I don't know if you saw, oh, you did, Representative McGuire, the note from Miriam about potentially starting Thursday's work session at 9:30 or 10:30.
Right. I sent it back to him because it's his subcommittee. It's up to him.
Okay, so I'll wait to hear from Representative Roy.
I'm here. 9:30 would be fine if that's what we need to do.
Okay, great. Thank you.
Yeah. Who's going to be on Zoom for the
Looks like almost everybody is here. So welcome to our resumed executive session on Senate Bill 133. We have 4 sections left. 6, 8, 12, and 14. It's here. And I think I will start on 14 because I like to get that one there. Representative Broder, do you have a motion?
Do we want to take attendance?
Oh, yes, pardon me.
Do we need the speech either?
Yes, Ms. Marling, do I need to give the spiel?
I think it's always safer. We've been doing it.
I have a spiel ready if you want it. Okay. Spiel away.
As chair of the House ED&A Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with House Rule 67 and the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet remotely. This is an executive session on Senate Bill 133. Please note, there is no physical location for members of the public to observe and listen contemporaneously to this meeting. However, in accordance with the emergency order, I am confirming that all members of the committee and select legislative staff have the ability to communicate contemporaneously during this meeting through the Zoom electronic meeting platform. And the public has access to contemporaneously listen and, if invited, participate in this meeting by the Zoom platform or by telephone. All necessary access information has been made available in the House calendar and through the electronic calendar on the General Court website. Notice for this meeting complies with House rules and RSA 91A. Anyone who has a problem accessing the meeting should call 271-3600 or email hcs@ledge.state.nh.us. In the event the public is unable to access the meeting will be adjourned and rescheduled. All votes that are taken during this meeting shall be done by roll call votes. We'll start the meeting by taking a roll call attendance. When each member states their presence, please also state whether there's anyone in the room with you during the meeting, which is required under the right to know oath. Second.
Representative Allegro.
Here in the room.
Representative Bailey.
Present in the committee room.
Representative Fellows. Not yet, I guess. Representative Fontenot.
I am present and my wife is in the house with me.
Representative Goley.
At home, and my wife is in the other room.
Representative Groda.
I am in my home office and I am alone.
Representative Judy.
I am in my studio music. My wife, she's downstairs.
Representative Lanzara.
Hi, home in Nashua and some family around.
Representative Lekis.
Present in the committee room.
Representative McGuire.
Present in the committee room.
Representative O'Brien.
I am present. I am home in Nashua and I am alone.
Representative Pearson.
I am in my office at our medical center in Kingston, and I am alone.
Representative Roy.
I am here. I'm in my truck. At some point, my son will be joining me.
Representative Santonastaso.
I'm here alone in Ringe.
Representative Schmidt.
I'm present in my home office in Dover and I'm alone.
Representative Schuett.
I am present at my home in Pembroke alone.
Representative Schultz.
Hi, I am in my residence in Concord and my husband will be in and out of the room, including now.
Clerks in the room. Representative Yakubovich.
Present at home, alone in the room.
And we will try Representative Fellows one more time. Please alert me if you see her before I do. Thank you. I don't know Representative Fellows at this time.
All right, thank you.
Full house otherwise.
Okay. So the plan for today is to do the vote on the 4 sections we have not yet voted on and then recess so that we can have our researcher come together with a comprehensive amendment to the bill. So Representative on section 14, Representative Broda, you have a motion? That's the Wallner non-germane amendment. You'll have to unmute yourself, Jackie.
Thank you. Thank you. Yes, I move on a pass on Representative Wallner's non-germane amendment regarding the daycare hours required.
Second, Chris Schultz.
Okay, here's Representative Fellows.
Okay, Representative Fellows,
Present at home alone.
terrific, thank you.
Sorry, I was at a Senate meeting.
I'll be glad to second it
Okay,
unless somebody else wants to.
that's fine.
Oh, I did also, could you not hear me second, but I'm fine with Representative Lekis, that's fine.
You're being inaudible, Chris.
Some people's dream. Can you hear me better now?
That's better, yes.
Thank you.
Okay.
Would you like me to speak to my amendment, Madam Chair?
Speak, please.
Thank you. This amendment addresses the need for immediate need for daycare workers in our state. And Representative Wallner, who is from that industry, and Representative McWilliams, who is also an advocate for daycare, both support this amendment, and I support it for the reasons that we need daycare workers in immediate need for daycare workers so that we can get our young families back to work, the parents of young families back to work.
Sound like us?
I have nothing further to add. I think that covers it.
Yes. Since we're being less formal than usual, Representative Baroda, I got some language from Melissa Clemens at the licensing office, and she suggested that that the documented life experience shall include experience with the same age children, because she thought that was an important distinction, and I would agree with her. Would you agree to modify your amendment with that language?
Yes, I will. I'll deal with it right away after this meeting.
Representative Lekis, you're okay? Yes, I've sent this out to the committee, and it makes perfect sense that if you know how to deal with a 12-year-old, you may or may not know how to deal with a 2-year-old.
Nobody knows that.
Thank you, Representative Schmidt, for that insight from your vast age and experience. Representative Saitek.
I'd like to say that's the other shoe that dropped because Ms. Clement wanted to say something after we had finished and she did not get an opportunity, and I think that's what she was up to. So that's kind of nice to
Yes,
round
she
that
sent
out.
me a note and she pointed this out, and I agreed with her on that issue, and so I'm bringing it forward.
May I point out my tenants would like to hear this, yes.
Yes, okay. All right. Is there any further discussion on this amendment, which would become section 14?
Madam Chair?
Yes, Representative Schiff.
Yes, we just clarify that this is amending the language of Amendment 1162H, is that correct?
Yes, it was the basic change to add some specificity for the life experience was approved by the subcommittee. This language came in after the subcommittee, and Representative Baroda has just accepted it.
Thank you. I just thought we should make it clear what specific amendment we are adding language to.
Yes, I am certainly hoping that we will get a real honest to God numbered amendment in time for all of us to read it. Schedule is that next Tuesday, there's a work session in the morning, and we will have a final executive session in the afternoon, and we should have all our final amendments at that point, I hope.
Thank you.
Representative Lekis, second, you go along with the,
Yes.
He said so already.
I'm sorry, I did not hear that.
Okay. Is there anyone else who wishes to speak on this amendment? Yes, Ms. Marlin.
I'm sorry, I was just typing. I just want you to know that it's in the draft as you just adopted it, as you just spoke about it. So I'm with you.
Adopted it, but yes, I'm glad you've got everything.
Madam Chair, I just want to therefore understand that Ms. Smarling is going to put this language into her final amendment, and that I do not need to contact OLS. Is that correct?
No one needs to contact OLS on any of the amendments at this point. We will be getting a final committee amendment that includes all the bits and pieces.
Okay, very good.
All right. Anyone else wish to discuss this? Comments, questions?
Well, if Pam could fix the participants list where it shows executive departments instead of the individual, that would be a little bit helpful, keeping track of who's here and not.
Yes, thank you. I did a couple, and a few people went and corrected their names to be more proper.
Right. We just need to know who the
gentleman
are.
Representative Yakubovich.
Is the M.
Yep. I'm not sure who the other one is.
They all answered the roll.
Yeah, they answered the roles. They're here. Okay.
So if that last person who's not showing themselves would just let us know who it is. I'll keep an eye out.
Okay, thank you. Yes. Some fellows. Anyway, we'll find out. Okay, any further discussion on this, adding this amendment? Okay, no hands up, no voices here. So the motion is on the amendment to the non-germane amendment. I believe
The non-germane amendment to the amendment.
it's germane. Well,
Oh, we're gonna do two votes, one for the language.
yes,
change.
we have two votes, one for the language change made by the subcommittee, and one to adopt the amendment as part of the bill. Yes,
Is that, wait a minute, aren't they?
You mean the section is part of the bill?
yes. Ms. Marling, help. Do we need two votes on this?
I don't think you really do, as long as everybody is clear what you're voting on. You're taking the Wallner McWilliams amendment, but changing that, adding a new sentence to the end of that subparagraph N, which was the Melissa Clement language. I hope everybody got the email that outlined that yesterday, and that should be hopefully clear.
Okay. In that case, we will have one vote to incorporate this amendment under discussion into Senate Bill 133 as section 14. Right, everyone understand? Yes. Thanks. Speak now or forever hold your peace, and the clerk can call the roll.
Representative Roy,
Yes.
the clerk votes yes. Representative Pearson,
Yes.
Representative Yakubovich,
Yes.
Representative Lekis,
Yes.
Representative Allegro,
Yes.
Representative Bailey,
Yes.
Representative Lanzara,
Yes.
Representative Santo Nastaso,
Yes.
Representative Dolly,
Yes.
Representative Schuett,
Yes.
Representative Judy,
Oui.
Representative Schmidt,
Yes.
Representative Schultz,
Yes.
Representative Fellows,
Yes.
Representative Fluntno,
Yes.
Representative Groda,
Yes.
Representative O'Brien,
Yes.
the chair.
Yes.
And we're looking 19-0 on the adoption of section 14.
Excellent. Representative Kubovich, your subcommittee had a recommendation on section 6, the music adoption of music. Do you wish to make a motion?
I'm sorry, Madam Chair, I didn't hear all of this. This is for section, I'm sorry, can you repeat that part?
Yes. I'm calling on Representative Kubovich to make a motion on section 6, licensure and regulation of music therapists from the subcommittee.
I motion to ITL this section.
Okay, is there a second?
Second.
Madam Chair, are we not going to consider the amendment that I sent to you, that I was sent to the committee?
No, not unless we vote down, unless the ITL is lost.
I seconded the ITL. Did you get that?
We had several other people did at the same time, and so.
Okay.
The second.
Yeah, it was
Allegro.
Allegro was second. Who moved it? Yakubovich, of course.
Do you care to speak to your motion?
Yes, we've discussed this matter previously in the committee a few months back, and I don't believe at this time we need to pass this section. Thank you.
Representative Allegro?
I have nothing to add. We've discussed this pretty much at length already, so thank you.
Yes, I will mention that House Bill 209 was moved ITL and not voted on, so it's in limbo. That was the committee position at the time.
Madam Chair, if I may.
Yes, Representative Proda.
The issues that this committee discussed concerning this amendment had to do with the fact that some of the considerations from the previous bill had not been considered, as well as the harmonization of the language between the music therapists and ASHA. And all this has been accomplished in an amendment that was submitted to the committee. And a lot of work was put on this, and I would hope that when people vote today, they will consider that. Thank you.
Representative Roy.
I would just ask Representative Groda, because I'm not familiar with the amendment. Is it anything new that we haven't already discussed regarding music therapists in the previous months ago and last year regarding the licensure of music therapists?
Yes, thank you for the question. There was a disagreement in the language, or there was a disagreement in how music therapists versus speech therapists did their work and how their territories were going to be carved out. And this has been agreed upon between the two organizations on the national level. And this language was sent to me, and Ms. Chesterly, who was represented the audiologists who had who had not supported the amendment, now supports the amendment, has withdrawn her protests, which I think is a significant change. Thank you for the question.
Representative Schultz.
Yes, Madam Chair, thank you. I appreciate the hard work that Representative Groda and others have done to have that level of work and compromise. I think we need all the tools we need in the toolbox should be available. And I think if we ITL this, I do think that this will leave music therapy only available to those who can afford it. And I think that is a shame.
Thank you for that position. Anyone else? Representative Saitek.
The amendment clearly would make the bill better, and if the bill goes forward, I would vote for the amendment because it clears the areas of areas of practice. The trouble is, as I said in my parliamentary inquiry when this came up last session, and perhaps this will eventually survive, ED&A is charged with public health and safety, not desirability, or the path, or ironing out the path, taking the first step down the road of insurance reimbursement. If we change our charter, or if that happens, and it's a question that it's proper for us to consider this in, so that they can get insurance reimbursement, okay, but that's not our charter. They do have right now certification. There is a national organization that attests to their credentials. So I'm unhappily not supporting this because they're good people, but that's not our charge. And so there I am. Excuse me, let me just please finish with this. I cannot see a credible threat to public health and safety if this is unlicensed. I've heard that, but it's just not believable to me. And now I am finished. Thank you.
Thank you. Representative Golick.
Thank you, Madam Chair. I will be voting against the ITL. I think it's a big accomplishment that these two groups have come together with language that they both can support going forward. And I think it delineates what the two practices can and cannot do. And so I'm hoping that we can defeat the ITL so that this amendment can be considered and hopefully adopted. Thank you.
Representative Pearson.
Thank you, Madam Chair. As most of you know, I chair the Health and Human Services Committee of the House, and we've looked at this kind of issue. But what you probably don't know is since age 16, I have been a professional church musician, directing choirs and playing the organ. And every once in a while, it has been my experience and the experience of other people like me, where music can be a wonderful help in many ways to people. But when we look at professional music therapists, I have a big red flag raised, and we are on page 38, lines 25 and following of at least the bill as it's located on the House website. The practice of music therapy, it says, does not include the screening, diagnosis, or assessment of any physical, mental, or communication disorder. That is quite different from the therapists I know, including art therapists and others. If you cannot diagnose something that is wrong, if you cannot screen for it, if you cannot give it a descriptor, that's just leaving good folks who are musical and use their music to help people who may need a little bit of help. In other words, this is either too much or too little, and I really don't see the need for such a section as this to go forward.
Thank you. Representative Schmidt.
Thank you, Madam Chairman. Well, we are definitely talking about the health of young children. I've been in one of the establishments in Dover that happens to be in my district, and they deal almost exclusively with young children, and they're not just playing music to them by any means. This is a recognized profession and specialty. The language that Representative Pearson just alluded to is to differentiate them from speech pathologists and audiologists, who are medical professionals, not necessarily mental health specialists. So because this is a profession that we are not the first to recognize by any means, I think that we should definitely act on behalf of children's better mental health, and I will be voting against the ITL as well.
Thank you. Is there anyone else? Okay. Representative Judy. Representative Judy.
Oh, I'm sorry, Madam Chair. I'm really sorry.
Oh.
Yes, members of the committee. Music make a difference in people's life. For example, when I get involved in the accident, 1993, they try everything for me mentally. But a friend of mine starting playing music for me. And then he was in the phone. He was in New York City. I was here in New Hampshire. That's make a big difference in my life. And after 3 or 4 sessions, he's not a therapist, but we go up together in Haiti. We used to play soccer, and he knows he wants to do something in my life. And then he start playing music. He play guitar, he play drums, he play organ. And after a month, I feel different. I have that in my mind since 93 until today. I'm going to vote against this ITL because music can make big difference in people's life. Thank you.
Representative Sherwood.
Thank you, Madam Chair. I believe that during the original bill, even we heard testimony that through the use of music, some of these folks have been able to reach particularly disturbed autistic children and Alzheimer's patients. Representative Sytak, if that's not somewhat healing, I don't know what would be. Thank you. I will be voting against ITL.
Representative Browder.
Thank you, Madam Chair. Music therapy is used for people who have executive function disorders, who are autistic, who have cognitive function disorders. This is not. This is used as a way of reaching those people and helping them learn a different way to learn than the conventional way that those of us who don't have those dysfunctions learn. So I think that it's an important consideration as a group of therapy. And it's just not about listening to music and playing music. Thank you. I think that we all know that, having heard testimony and seeing the testimony from last year.
I'd like to say that I'm delighted that the audiologists and the speech language pathologists have worked out their conflict with the music therapists, because there are music therapists in the state and they are able to work. As Representative Schmidt has testified, they have a center in this town. The issue is, do they need to be licensed? And that's an entirely different matter than, is music therapy a good thing? And so that's the point that we're voting on, is should they be licensed? And is there anyone else who wishes to speak? Yes, there's a few. Representative Pearson and then Representative Groda.
I do very much appreciate the positive comments made on the use of music to help people. My concern is that since they are not involved in screening or diagnosis or assessment, which is often what various licensed, board certified, board licensed professionals do, certainly we can have music therapists in the state to our profit. The question is really, do we need to license them? And that's why I support the ITL. I don't think we do. I think they can carry on as they have been.
Representative Groda?
Thank you, Madam Chair. The purpose of the license is to support the training that these individuals go to. There are specific courses and specific training and specific degrees that are geared towards that. And one would hope that we would support that so that the individuals who tout themselves as music therapists are actually licensed music therapists and have taken the necessary courses and have the necessary knowledge to address cognitive learning skills. Thank you.
Representative Schultz?
To Representative Pearson's point, and I do think it's a good one, there are other aspects of the medical field that we license that do no diagnosing of any kind, like RNs, psychiatric RNs, LNAs. There are multiple healthcare providers that don't diagnose. I don't see that as, for me, as a reason to not license them. I think that they have demonstrated the proper level of professionalism and a need for our citizens to have access to licensed professionals as recognized by the Granite State. So I will still be voting against ITL.
Representative Blackus?
Thank you, Madam Chair. I heard concerns about making sure that people that present themselves as music therapists have appropriate training. It's my understanding that there's already a certification available through a national organization. And if someone wants to know whether or not the music therapist they're considering hiring has appropriate training, they can ask for that certification. I don't see a need for license.
Representative Saitek?
Representative Schultz, the people you just referenced as not doing diagnosis can have a direct effect on somebody's health or safety. I don't see that. A nurse with improper medication or other applying wrong therapies can do real harm. It is hard for me to believe, as I had said earlier, why am I wasting everyone's time, I suppose, that how this can actually be injurious, that the public needs to be protected when there is a level of certification available. Look, I lose the debate every day on its effectiveness or its desirability. I think I win the debate on public health and safety.
Okay. That note of triumph.
Well, it's not triumph. Look, I'm not.
Is there anyone else who wishes to say something? All right, seeing none, the motion is inexpedient to legislate, which will delete this section from Senate Bill 133. Clerk will call the roll.
Representative
Yes.
Clerk votes yes. Representative Pearson,
Yes.
Representative Yakubovich,
Yes.
Representative Lucas,
Yes.
Representative Allegro,
Yes.
Representative Bailey,
Yes.
Representative Lanzara,
Yes.
Representative Santo Nastaso. Are you there?
He's there.
Yes.
Representative Goley,
No.
Representative Schuett,
No.
Representative Judy,
No, monsieur.
Representative Schmidt. Representative Schmidt,
Sorry, no.
Representative Schultz,
No.
Representative Fellows,
No.
Representative Fontenot,
No.
Representative Rhoda,
No, thank you.
Representative O'Brien,
No.
and the chair.
Yes,
It is 10-9. ITL.
the same as House Bill 209. All right. Section 8 regarding skilled medical professionals. Representative Yakubovich. Your motion?
I'm looking for the section. I'm sorry.
Section 8, skilled medical professionals.
Page 47.
On 20.
Can somebody else make the motion?
Right. I'll move inexpedient to legislate, which I believe was the recommendation of the subcommittee.
I second.
Thank you.
I'll say that at first it was the recommendation of the subcommittee, and after that meeting, several people approached me on the issue, and we agreed after a few rounds of discussion that it was not really necessary. Representative Fellows?
From listening to the discussion about that, it seemed to me as if maybe the Senate had good intentions, but didn't realize that it would actually severely restrict the number of people who could make that assessment.
Exactly. Representative Pearson.
Thank you, Madam Chair. This was one of the sections that was sent over to me as Chairman of Health and Human Services. I spent some time discussing this with the Department of Health and Human Services, and there was an accusation that unless we restrict it to registered nurses, anybody off the street, including the janitor, can make a diagnosis. But what's in place presently is the strikeouts. So it talks about in line 29, an individual with equivalent training designated by the department. And they said their present practice is to do exactly that. They don't have their secretaries or their janitors make these diagnoses. But to restrict it to registered nurses, which line 32 would have us do, would significantly up the cost without providing any better quality of product. Because the operative phrase in line 29 is an individual with equivalent training. That's what they do now. They haven't found difficulty with that. To restrict it to nurses would hamper the work that they're doing in various places. So I've talked with others in the medical field as well, and the consensus I heard was leave it as it is. You take out section 8, it reverts to what it was, which is the strikeouts.
Thank you. Other comments, questions, concerns? Right. Seeing none, the motion is ITL, which is to remove this section from Senate Bill 133. And when ready, the clerk will call the roll.
Lord,
Yes.
the clerk votes yes. Representative Pearson.
Yes.
Representative Yakubovich.
Yes.
Representative Blackus.
Yes.
Representative Allegro.
Yes.
Representative Bailey.
Yes.
Representative Lanzara.
Yes.
Representative Santo Anastasio.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Judy.
Oui.
Representative Schmidt.
Yes.
Representative Schultz.
Yes.
Representative Fellows.
Yes.
Representative Fontenot.
Yes.
Representative Groda.
Yes.
Representative O'Brien.
Yes.
And the chair,
Yes.
19-0.
Right. Section 12, telemedicine provided by out-of-state psychologists. Mr. Nikubovich, you have a motion?
I have a motion with the amendment to OTPA with an amendment sent by Pam
Okay,
this morning.
so that amendment is, there are two of them. Which amendment do you choose?
8 o'clock this morning, 8:03 this morning.
Okay.
Just to confirm, Madam Chair, is that the amendment that Dr. Warner requested me to put in?
I don't know, Representative Schmidt, because I also had one that I put in on the benefit from OPLC, which is somewhat different from yours, but we need to know which one Representative Jakubowicz means before we decide which is the one we should be discussing.
This is the OPLC draft legislation.
Okay.
5321 LBC.
All right.
And 8:03 this morning.
I helped to write Representative Schmidt, and I will second the motion.
So we have to hear it, right? Here.
And we have, yes, they're both here. They've both been sent out. They're somewhat different. So, do you wish to speak to your motion?
Oh, sure. Yeah, this is the OPLC amendment. As Pam stated, it's been created with consultation with Lindsay Courtney. So this is the one I would like to move forward. Thank you.
Yes, and I will speak to this. I helped discuss it. I asked Lindsay to write it when we were discussing it. The issue is that at the moment, approximately 2/3 of those psychologists licensed in the state of New Hampshire have temporary or emergency licenses. And the reason, and they have not had any success in converting those to permanent licenses. Anecdotally, this includes people who live in New Hampshire but practice in Massachusetts or Vermont or Maine because they can get a license there. And even though the requirements are on paper almost identical, they can't seem to get a New Hampshire psychologist license. So what this amendment does, it requires a license. A person with a temporary license to practice or an emergency license that has worked in the state for at least 90 days in good standing and completes the application and pays the fee and is promoted to a full New Hampshire psychologist license, which by statute specifically allows them to practice telemedicine. And I think that makes a lot more sense than trying to create a new level of license. Since we already, since the act required as part of the regular license. So I would hope that we can eliminate the bottleneck at the board, which is what I think we should do. And Representative Lucas.
To just help me understand, I see that this continues allowing this, well, anybody who's got a temporary or emergency license can get, meet certain requirements, can can practice. What does this do to deal with the bottleneck?
It's at the back, flip it over on the back, Roman 4. It says, notwithstanding any other provision of law to the contrary, the Office of Professional Licensure Certification shall issue a license. The Board of Psychology seems to want to require essays and interviews and data from your supervised practice when you're beginning school transcripts, which are a bit of a hassle if you've been in practice.
Okay, so the bottleneck is getting people the emergency licenses. It's not just the normal status of somebody applying for a license under normal times.
No, the emergency licenses are issued within, I believe it's 30 days. The thing is that what this would do would allow someone, the bottleneck is getting a permanent full psychologist license.
Sure, I guess.
Which is under the control of the board rather than the appeals.
Right, so I assume the temporary or emergency licenses, are they going away after the state of emergency, or will they continue? And if they're going away, this might provide an initial group of people getting permanent licenses, but is it going to help going forward?
Temporary and emergency licenses are already in statute for psychologists. It is not based on an emergency order. It's only the emergency license that is granted by the OPLC that is an emergency order. But there are 329B:20 already deals with temporary and emergency licenses.
Thank you.
Anyone else?
Madam Chair, I was trying to raise my hand, but it
Rhoda.
recognized me. I do have a question about the amendment. So the amendment strikes out in line, I'm not sure, it's the beginning of the amendment. It strikes out temporary and emergency and replaces it with applicants from other states. And then at the bottom, it says, Section 4, notwithstanding any other provision of state law to the contrary. It starts with this. The first point is A, the individuals has practiced in New Hampshire under a temporary or emergency license. So how do these things, do these things not sound conflicting to you?
I'm sorry. Do these things, I missed that last part.
Oh, so sorry. The section A, where it says the strikeout of the title of this section, which just strikes out temporary and emergency. It refers it to applicants from other states. And then section 4 of the amendment, the very bottom, says that the OPLC shall issue a license to practice psychology or school psychology to any individuals who have met the following requirements. And it says A, the individual is practiced in New Hampshire under a temporary or emergency license for a period of at least 90 days. Where does this refer to a different part of the bill?
Yes, Representative Groda, if you look back on the beginning, part Roman 1 is a person licensed to practice psychology in another jurisdiction can apply for a license, and it gives you the requirements for that. Roman 2, and that would be temporary licensure. If you look down there under 1E. So this is an individual seeking temporary licensure. So Roman 1 is how you get a temporary license. Number 2 is a declared person licensed in another jurisdiction providing services in response to declared disaster.
Okay. I see. Excuse me, of course. Okay, I understand.
Yeah. 3 is a temporary practice, is for somebody who's applied for a temporary license. So that's it talks about all of the issues. Representative Goley?
Thank you, Madam Chair. I was actually going to bring up the same questioning about striking temporary and emergency applicants in regards to this. So I think with that being said, I am all set.
Any other questions or comments? Here, no hands raised. Representative Fellows.
Yeah, I'm just I'm just kind of confused because I was on the subcommittee for 133 and we discussed the telemedicine part of it, but I don't remember any discussion about what this amendment is about. Did I just forget it, or was it discussed in a different subcommittee, or what?
It was discussed in a different subcommittee. At the public hearing on 133, during this section, Representative Lindsay, not Representative, Director Lindsay was saying that this is they weren't really in support of this because they didn't think it was entirely necessary because their statute already has emergency and temporary licenses, which would allow them to do telemedicine. I don't believe that came up during the subcommittee, as I recall.
So does the amendment, is it tacked on to the end, or is it replacing what is now section in the as introduced in section 12?
Places it.
So I just feel a little uncomfortable that we didn't hear testimony on this amendment. At least I didn't.
Okay.
Another subcommittee did, or?
No, this was it came out of a private discussion that I was having with the director of OPLC and I asked her what she meant by not thinking section 12 was necessary, and she pointed out that they had this. And we were talking about how many emergency licenses they had. And I said, well, what we really need is a way to get the emergency licenses converted into full licenses. And therefore came up with this language.
Okay, thanks you. I understand, and I feel uncomfortable with going ahead with something that's so different that didn't get a public hearing. Thanks.
Fair enough, Representative Goley.
Thank you, Madam Chair. So is it my understanding that this amendment replaces section 12 completely?
Yes. I'm sorry that wasn't clear.
Yeah, because it just says to include the following, doesn't say replace. Okay. All right, thank you.
And can I just interject, Madam Chairman, would the effective date of this amendment be July 1st, 2021, as it is currently for part 12?
Thank you, Ms. Marling. I was just going to point that out.
Okay.
Don't, unless someone has some objections, I think that makes sense. Because we do have, like I said, 2/3 of those licenses are emergency licenses. I think it's astounding. Any other comments, questions? Right, seeing none. Motion is to adopt the amendment under discussion. And clerk will call the roll.
Madam Chair?
Yes, Representative Schuett?
Yes, will this amendment incorporate that effective date at the bottom as the original bill has?
That's the kind of thing that we can confidently trust to our.
I just wanted to be sure that that's understood when we vote.
Yes. Representative Saitek, you may call the roll.
We're talking about the OPL, so-called OPLC amendment.
Correct.
That we've been discussing. Yes. Okay, Representative Roy.
Yes.
Clerk votes yes. Representative Pearson.
Yes.
Representative Yakubovich.
Yes.
Representative Lekis.
Yes.
Representative Allegro.
Yes.
Representative Bailey.
Yes.
Representative Lanzara.
Yes.
Representative Santo Nastaso,
Yes.
Representative Goley,
Yes.
Representative Short,
Yes.
Representative Judy,
Oui, monsieur.
Representative Schmidt,
Yes.
Representative Schultz,
Yes.
Representative Fellows,
No,
Representative Fontenot,
Yes.
Representative Groda,
Yes.
Representative O'Brien,
Yes.
the chair,
Yes.
18-1.
I'm impressed. All right, that takes care of the last section of Senate Bill 133. And Ms. Marling, how soon do you think we can get the amendment?
I think I can have it cleaned up and sent. If you'd like to review it first, I can send it to you, or I can send it directly to OLS. I would have to ask them how long it would take. So much depends on how tied up they are with the budget and everything else.
Right, so probably not today then.
Oh, definitely. I feel confident that it would not be today.
Okay, in that case, the further schedule is that there are work sessions scheduled for this coming Thursday, the 13th, on Senate Bill 155. And is there another one as well, 104? No, sorry. And on next Tuesday, we have 104, and what's the other one?
And 58.
Yeah, yes.
Those are exciting.
So no, those are the final work sessions of those. And then there is a executive session in the afternoon of Tuesday. And I hope we'll be able to vote on all 4 of these bills.
What I have is 9:30 subcommittee on Tuesday, the 18th for 58 and Senate Bill 104, and then 10:30 executive session. Is that not?
I believe that Miriam suggested we make it 1 o'clock for the executive session, and I think that makes sense.
Okay, I did not see that.
In any event, we'll go with what's in the calendar and do the executive session after the subcommittees.
So do you want to add anything to the subcommittees? Is everything scheduled?
Not all 3 bills, other than 133, have a subcommittee scheduled.
Okay.
And 133, we should have the exec ready. Representative Yakubovich?
Yeah, on this Thursday, something that I got a notice for 9:30 a.m., but well, I got a panelist invitation, but no notice of the subcommittee. Can you please tell me which subcommittee?
That's the subcommittee on Senate Bill 155 and its non-germane amendment.
Right, and that went to the full committee just to cover all bases if you're interested in attending. So it wasn't just limited to subcommittee members to be all inclusive, but that is the only scheduled meeting, the subcommittee work session on 155.
And who are the committee members then?
What's that?
Who are the committee members? I'm sorry.
Representative Roy, the chair.
Representative Roy, me, Chris Schultz.
And Tony Lakis.
And Lanzara.
And Lanzara.
Okay, thank you.
All right.
Madam Chair, did you not say the subcommittee on Senate Bill 104 meeting on Thursday, this Thursday also?
May have said it, but I believe that's actually meeting on Tuesday. Representative Pearson's 2 bills, that is 58 and 104, are meeting on Tuesday.
Right. I thought you had just stated 104 a few seconds ago.
I might have, but I was wrong.
Okay, thank you.
No, you said the 18th, Carol.
Okay, yeah, that's next Tuesday.
Correct.
And then we will follow that subcommittee, which if I interpreted what I heard over the Zoom correctly, they should just be looking at the final amendment and blessing it because they had reached agreement in principle. All right, Representative Wright.
Just, I have a question, Madam Chair. In subcommittee this morning, it was stated that the subcommittee meeting on Thursday morning would be at 10 o'clock, but the hour of 9:30 was just mentioned. So which is it going to be?
9:30. That's for
9:30.
the convenience of our researcher who has two other places to be at 10 o'clock.
I recall her mentioning that. So 9:30, I will make a note of it. Thank you.
Representative Baroda, you have another comment or question?
I do. I just want to make sure that as we're making motions to these subcommittee, these subsections of these bills, are we to write committee reports on the section that we made the motion on, or how is this going to work in the calendar?
Write a few words on the sections that you wrote up. I'm stitching it. I'm stitching the committee report together. So just send it to me and I'll put it in.
All right, thank you.
Oh, I'm sorry. I've got a question now. What is the thing that starts at 9:30?
It's the subcommittee on Thursday on Senate Bill 155.
Thank you.
And Representative Goley, if I understand correctly, you're going to consider a minority report. So.
Jeff, you're on mute.
Yes, yeah.
I need to look at the final product before I determine whether or not I will do a minority.
Fair enough. We'll be passing that amendment out as soon as it's available, so you all want to take a look at it. Anyone else have anything that needs to be done? All right. I am really impressed that we managed to get through this.
You have an impressive group, Madam Chair.
Yeah, it's hardworking, yes. I was not surprised on the vote on section 6 either. That's a repeat of what we did before. In that case, we will close the meeting and let the subcommittees have their fun.